Here.
I don't see Melissa yet. Matt Fee.
Here.
Thank you. And then I will go through town staff members who are present this evening. Roberto Santamaria.
Here.
Jericho Miele.
Present.
Libby Gibson.
Present.
Erica Mooney.
Present.
Janet Schulte.
Present.
Brian Turbot.
In attendance.
Thank you. Rick Sears.
Present.
Rob Ranney.
Here.
Thank you. We also have Gary Shaw, the CEO of the hospital, with us this evening.
Here.
This open meeting of the Select Board is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the Governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment as previously noted through the Zoom webinar functions. Please note that this meeting is being recorded and that all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and to take care not to share the screen of your computer. Anything that you broadcast may be captured by the recording. All supporting materials that have provided members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless we say otherwise. I will introduce each speaker on the agenda. After they conclude their remarks, I'll go through as people raise their hands with questions and comments. Please remember to keep your phone or computer muted when you're not speaking. Please remember to speak clearly in a way that helps generate accurate minutes. If you wish to engage in conversation with other members, please do so through the chair, taking care to identify yourself. And finally, each vote that, tonight will be taken via roll call of the board members. So with all that being said, I know you all are, love hearing that speech. We will accept the agenda, I believe, as written. I don't think that there are any changes. There weren't as of this afternoon. So we can turn it over to announcements. We've already got the first one covered, but Libby, did you want to cover the others?
Sure, thank you. We've got a couple. The Finance Committee is having a public hearing this Thursday, the 10th, starting at 5 p.m. on Zoom webinar. There's a link on the town website. And if you would like to participate, please register as an attendee. They will be discussing citizen warrant articles. There are some specific ones. And we also have a micro inequities, managing unconscious bias, leadership and diversity seminar, which is a virtual webinar that's going to be held next Tuesday, December 15th from 9 to noon. Registration through the Chamber of Commerce website. This is a free webinar. We highly encourage the community to attend. It's sponsored by the Chamber, the town, and somebody else, Melissa.
Community Foundation.
Community Foundation, of course. Thank you so much. So a lot of us are already registered for it, so we hope that more people will do so. And I think that's it.
Thank you. Next, we will turn to our COVID-19 weekly update. Are there any opening public comments? Don't see any. I'll turn it over to Public Health Director, Roberto.
Awesome, thank you. Like normal, I'm gonna do the screen share. So here we go, it's somewhere here, we go. So today, We received our 26 cases, which is, it's high. It's higher than we want it to be, but it is still in that 10% range. So far today, we've given over 17,000 tests. Thanks. All of it has been done at the Cottage Hospital. So it's been a tremendous partner there. So we've been having a big issue with spread, and in the last 7 days, we've had 136 cases. And that's really important to really wrap your head around that we've never seen cases this high in such a short period of time. So really quick, that metric, it's a bad trend with the positivity test rate. So it's past that 10%, which we think is partially because of a selection bias. If you're feeling sick and you show up to us to get tested, you're more likely to show up positive than if you're completely not sick and you still show up to get tested anyway. So that's one of the reasons why you're not seeing large scale shutdowns and things, even though this is red. So this is what we're getting at, 10.2% of the 7-day average. Number of individuals who have died, we're still in good shape there, thank God. And we've been really lucky there. Number of patients, we have transferred some, but we have still below 10 here. The healthcare readiness, the reason you'll see that yellow in the metrics in the last slide is because the state has also already opened a new field hospital last week. I believe it was in Lowell. I wrote Lowell, but I'll have to check again to see if it was Lowell or Lawrence. I wasn't exactly sure when I wrote this a few minutes ago. So testing capacity, we're definitely getting a lot coming in. So just anecdotally, I'll let Gary answer if there's any other questions about how the testing capacity is going, but it's a lot. It's significant. So we do have to keep an eye on that. And same with the contact tracing capacities. As far as the sewer index goes, you'll see in a couple slides that it's showing a spike of 15 cases per day on average, which is more or less what we're seeing. So the trend is in the same way. This is cumulative since March when we first started collecting this data, and we're now up to about 525. So this is the last 30 days that we're seeing, or the last month really that we're seeing, and this is the spread we're seeing right now. This is these last 7 days, the 136 cases. So it kind of jumps really quick, and so we need to pay attention to our mitigation standards, and we need to slow down this curve. So with the sewer trend, this is the most recent one we have. Going into Thanksgiving, we were here. This was the Thanksgiving numbers. And then the week after Thanksgiving, we were there, which it more than tripled where we were before. I know that's pretty small, so let me actually slide for the people watching at home. So this is where we were going into Thanksgiving. And then this is where we are now. So it is all, and to see the full scale, that's the virus concentration. So I just wanted to zoom that in so that people can see it if they're watching at home on TV. So it's predicting 15 new cases per day, which when you see the 26 cases that came in today, that is 1 day's worth of testing. So it is still higher. So this is now starting to be a little underreported, but it is still pretty close. And what's more important to see is this general area in the graph. However, what we are seeing is a consistent a little bit over a 1-to-1 transmission. So you'll see that that even though the trend line is, we'll see a lot of ups and downs, that trend line is relatively, for as awful as it sounds, flat at 21, 25 cases or so on average. So when you calculate the 7-day R value, you're looking at 1.42. So for every 1 case, we're getting another 1.4 more cases. So for every 2 people or so, it's spreading to another 3. This is what we're seeing across the state. The state is at 1.17. So what we're seeing is actually a lot higher number. Like I said in the Board of Health meeting on Sunday, our R number tends to skew a little bit higher because I can't account for a dynamic population, and we're a relatively small population. So our number tends to skew a little bit higher than it actually is. So I would say give it a confidence interval of about a 0.2. So it can be as low as 1.22 or as high as 1.62 right now, or 62. So it's really important to see we are still higher at the state than the state, even at the lowest level of that confidence interval. And then today's announcements about the vaccine across the state. The governor's office issued this graphic today explaining the order of priorities for phase 1, 2, and 3 of the vaccines, plus a timeline. We are expecting the first few vaccines to show up within the next few weeks. But as you see in this phase 1, the very first top priority is the clinical and non-clinical healthcare workers. So those first few hundred vaccines that you'll see are going to be going to the hospital, and then from the hospital to long-term care, places like OIH, and then EMS, police, and fire, other congregate care settings and things like that. And that's going to go through about February. And then from about February through April, we're going to be seeing this area of phase 2, which even still, it's not the general population so the vaccine, when it becomes available, it's not going to be available to everyone all at once. We are phasing it in as needed. So this is where we're going to be going, and it does go in order of priority from highest to lowest. And then that's really it. I'm just trying to keep it short and simple. And then I'll let Gary and Jericho take over. Gary?
Yeah, thanks, Roberto. Well, I've got a couple of graphs tonight. I just had one come in that I'm going to put up in just a second. But this today actually is the compilation of my first full year here on Nantucket. 365 days ago, I arrived on a steamship, and it's been quite the ride. And but something that is fun to lean into and work through. So I thought tonight I would just cover a little bit of what we've learned throughout this year, and then go into what I see some of these numbers are that Roberto was talking about. We all know COVID's here. We all know that there's a vaccine on the horizon, but we've still got quite a bit of stuff that we need to roll through related to planning on getting vaccines out. So the next few months, the next 6 months, are really going to be a precipice of how well we work together as a community to really get COVID taken out and put to bed. So, what have we learned? We've learned a tremendous amount. When we first saw COVID coming along way back in January, February, we just, at that point in time, we had no real diagnostics to be able to address COVID. We really didn't have any treatments to address it either. It was felt that early on, as we would see people start to lose the ability to breathe, they'd be put on ventilators. And then as we started to roll through the coming months of how well did people do on ventilators, we found that they actually did better with some conventional treatments and not ventilators, some steroids and other things. So a lot of modification, on the care side, which is really good to see. We learned pretty quickly how this virus spreads and what we need to worry about. And we learned that, indoors it's more effective at spreading itself. We learned that it is droplet spread, and that it's generally person-to-person vapor, that's moving around that's giving us the problem. And we know that the risk is highest if people are unmasked, or they don't wash their hands, or they stay in close contact or have really frequent contact with somebody. So good to know how it spreads, because then we can start to put in mitigation steps. And that's what we've been asking the public to work on now. How do you avoid getting infected? A lot of talk about that, and what's effective in the commercial environment, what's effective in the cottage hospital, and so forth. We certainly know that masking works, and we know that eye protection works, and we know that hand washing works. And we know that distance is probably one of our most effective tools, and that means separating and standing apart a little bit, avoiding crowds, particularly with indoors, and use that sanitizer whenever you have it. So you've seen lots of different types of things come out addressing, how we set places up and what types of sanitizers to use. And we certainly want to keep our distance from people that we know don't feel well. So great that we've learned that particular component. We've talked about the symptoms of COVID, and we know that COVID really reflects a lot of what the common cold gives us, but it also has two uniquenesses that we've not seen in the common cold, and that's loss of smell and taste. So if you have that occurring, obviously, we'd want you to come in and be seen, but it also comes along with a lot of fatigue and cough, shortness of breath, headache, body aches, diarrhea, nausea, chest and abdominal pain. So pretty severe, depending on who's picked this up and what they're coming down with, but we certainly have learned about that. Interestingly, we learned that a whole group of people don't have any symptoms at all and still can be spreaders or super spreaders. So we've learned how to be able to recognize that through testing, and also how to separate us from those people that should be in quarantine and work through having that disease just burn itself out. We know that people with moderate disease typically recover and do well, so that's really, really good to know. But the age groups that we're concerned about that have the most impact are obviously those with comorbidities. And we've learned that if you have diabetes or obesity, a chronic pulmonary obstructive disease, a heart condition, hypertension, or an immune disorder, you're at most risk, for being impacted severely by this illness. And those are certainly the percentages of individuals that are over 65 or maybe not 65 yet that have those that we want to protect. And that's the whole issue of what we learned about how to keep COVID away from those individuals so we don't have them, succumb to this or potentially be extremely ill. Well, we've learned a ton around testing. What is a good PCR test? What isn't a test? What is serology? What isn't serology? And we've really robustly updated capabilities for collecting samples, getting them off island, pretty much anywhere in the country, and getting test results back. However, the uniqueness about testing and creating that ability to test creates a demand that also then has, now we've learned, the impact to completely overwhelm a medical facility, just due to the demand of people wanting to get that and how it impacts your property with people coming to get tested. So we do want testing to continue in great ways. We want to find this disease. We want to be able to have people know that they might have been impacted by it with a positive test, go home and quarantine and separate themselves from the rest so that they can let it burn out and recover and then regain their status in society once they're healthy. So when you look ahead to treatments, the world is still working on antivirals, and just from the standpoint of vaccines, the light at the end of the tunnel and all of this, there are some 40 different, well, let's see here. There's possibly the best news is there's about 100 COVID vaccines that are in development, with 40 or so currently in trials. We know that a couple are one's approved and some more coming out, so lots of promise there. The problem in getting this type of scourge, addressed worldwide is just the logistics, the sheer logistics of getting all these vaccines out. And as Roberto had indicated a little while ago, getting them here to the island, we're certainly anxious for that. And then getting them to those that need them, the priorities, and then the general population is certainly going to take some time. So, the help needs to come for everybody. And what we have found is that those that are most impacted with this particular illness are largely big numbers in the Black, the Latino, the Native Americans, and other minority communities. So being able to ensure that we've got logistics that get to those communities as well to deliver those vaccines to help them and help the general population to stay safe is certainly going to be a challenge, not only in Massachusetts, here on Nantucket, and across the country. So we'll be looking to get those out as soon as we can. Overall, we just can't let our guard down. Even though we've got new treatments and vaccines that are coming around, and we understand what this disease is and how it spreads, we just cannot let our guard down because we're really, at a precipice of keeping this community safe. So, I ask you, those that are watching and those on this board, to follow the mask mandates, limit holiday gatherings to household members only, obey curfews that might be there, either self-imposed or within your communities. Continue to practice that good hygiene, decrease social contacting, whenever possible, especially if you know somebody's been ill. And if you have symptoms, seek medical care so that we can help you understand what you might be impacted with and protect the rest. Overall, I ask each one of you to be honest with yourself related to what you might have been exposed to or know you have, and what you could do to the rest of the community if you spread it. With that, I'm going to share a couple of graphs that kind of lay out where things have headed. And as you go out on our website, you'll see that we've been doing a 7-day rate of illness. I'm going to show you, if you translate this, can you all see this? Okay. If you look at this, we're looking at a 14-day run rate here of what we've seen of the numbers, and you can clearly see, the 7-day the rate, the 14 over the top. Sorry, we've mislabeled the 7 on the bottom. It's 14. But we've got the positives that are at the top here, and in any one particular day, just because of how the results are reported out from the Broad Institute, we might have more on a particular day than is reported. As an example, this 64 actually turned out to be some additional results coming in from 3 days, the second, third, and fourth. But you can see a steady rise, and that's the concern that we have. I will tell you that the results from yesterday have come in this evening. And tomorrow we'll be reporting out 15 results. So that's down from 26. We haven't graphed that on here, but that's certainly good news. And if that trend continues, that's certainly what we would want to see. I'll also then put up here, when you look at those total numbers of patients that are out there impacted, can you see this graph, patients isolating at home? Is that something that's showing up? Not yet. Okay, let me stop share and let me go back over here to share and pull that document up. So that you can see this. And now can you see it? Okay. So these numbers are, when you look at the total number of cases that we have and a positivity rate, this is the trend of how many people at any particular time are at home isolating. And of course, if these people don't isolate, you can see through just how Roberto has presented pod information or isolate information of how quickly this could get out of control if people don't take it really serious and stay at home. We want to see this number come down. This is something that is way too high for this community and the number of households and families impacted, but that's a very big number. When we look at the risk factor and why I've kept talking about over the months, why we don't want to be overwhelmed at the cottage hospital, we want to be able to provide care. It's looking at the risk groups that are generally impacted more severely. And what you see here is an Excel spreadsheet, which lists on the left the age groups and the number of cases that we currently have on November 24th through December 8th. And you'll see that the populations that we've talked about that might be at risk, the higher age individuals, when you go over here to the 61 to 71 to 80, just not a lot of individuals in that category. And thank goodness for that, because they are the individuals that most likely could be severely impacted and end up in the cottage hospital needing a transfer or a ventilator. When you look at the smaller numbers of age or the younger people, 1 to 10, we're seeing a pretty large percentage of this whole pie chart being some really young kids. Now, typically we know that they do well, but we feel that that's an association that when this whole pie chart is looked at, this big area right in here is basically from 20 to about 50. That's the age group of people that seem to be impacted most on the island. And these children, we believe, are part of the families that are within this realm. What we've seen is mild disease, fortunately, with this group, and we have not seen it transition into a high level of significant disease with the young or with the elderly. So from that perspective, we're not anticipating that we're going to see a run on services at the cottage hospital, but we do anticipate with the total number of people that are impacted that we could see, more spread. So with that said, what we want to do is obviously not be impacted. We want to get vaccines going as soon as we can. I was told today that the Mass General will be delivering our vaccines on December 21st. Didn't hear a number of how many we would get initially, but I would think somewhere between 80 and 100. We'll see what comes out. We know that whoever gets a dose, the first dose, they are guaranteed to get their second dose since this is a 2-dose vaccine. And of course, then there's a vaccine schedule, a distribution schedule that I think Roberto's already covered, that's being made public today by Governor Baker's office. Lastly, I'll just say that there has been a lot of discussion around Governor Baker moving to have some more severe restrictions on surgeries or elective surgeries. We've assessed that information. We were getting ready to publish some material today about it so that you would know as a public whether you were impacted or not. Tomorrow, the Massachusetts Hospital Association will be releasing its assessment of that. But at this point, we don't feel that it impacts the Cottage Hospital. Those elective surgeries are generally the inpatient surgeries that are being done, not elective outpatient surgeries as we do a lot of here at the Cottage Hospital. So we don't really see an impact, at least tonight, on that. So we've not been calling patients and doing any cancellations of any surgeries. I'll just end my part and then go to questions and let you know that I believe in my heart of hearts that the Cottage Hospital is safe, that the staff here are doing all they can to protect themselves and you when you come in. I did have an appointment today myself, just a routine physical, and I see all the measures that the staff have in place to protect you and keep you healthy as you work through. So I would encourage you, don't put off your health care. If you need it, come in. We've learned over time how to work this whole scenario in the COVID environment extremely well. Our clinicians are well versed at it. You will get excellent care, and I encourage you to come in and be seen. So with that, I'll turn it back over to Roberto or Dawn.
I think, Libby, should we move to Jericho now, or is that later in the agenda?
Oh, Melissa has a question, and then we'll go to Jericho.
Thanks so much. While we're on the sort of status of things as they are before we move on to Jericho's report, Roberto, I know that the governor rolled back the rest of the state yesterday to phase 3, step 1, and we never got to phase 3, step 2. Can you just recap if that impacts any changes for our community members or our businesses?
Not a lot. There are some issues, some things that we still have in place that are more strict than the governor. For example, step 1 of the governor's rule allows for gatherings of up to 25. We still limit it to 10. Tables for us are limited. We're always limited to 6. We had actually let people go up to 10 on accident. That information got out a little quickly, but we've rolled back the tables to 6 anyway. The things that are definitely different as are what we're seeing don't affect us tremendously because most of our businesses are voluntarily taking it a little bit higher, but with restaurants, they have to limit the seating down to 90 minutes, which is something that no one has ever done, so that you're not sitting there and having drinks and things like that. It's not a problem that we've been seeing here, but it is definitely a problem we've been seeing in other cities in the state. The museums, libraries, gyms, things like that, they've all been moved down to 40% occupancy, but our museums here and the Athenaeum had voluntarily closed. So that doesn't affect us tremendously there. The 40% occupancy is pretty big but we were already operating under 50% occupancy. So it's just, that extra 10% drop. Those are the main differences. We started scouring through now so that we can get in a nice chart, all the differences for a better visualization, but those are the big primary differences that we're seeing.
Great. Thank you so much. I appreciate that. And I think it was Worcester that set up the field hospital, if I'm remembering the press release. There's a second one now?
There's 2. Worcester
Right.
was the first one.
Okay.
Boston is in standby. They haven't had to activate the Boston one. But last week, he announced either Lowell or Lawrence to open theirs. But I didn't exactly remember which one. I can pull it up.
Yeah, don't worry about it. And that rollback and how that any changes for the state and locally would take place on Sunday the 13th. Is that correct?
Correct.
All right. Thank you so much.
Christy?
Thank you. With the increase in cases, I know there's been an increase in cases at the school, and I was wondering if you could go over a little bit of how the contact tracing works within the schools.
Yes. So I just opened it as Lowell. So it was Lowell's. They announced it last week. So I asked for a quick clarification today on that, just to make sure I mentioned it correctly. So let me pull up that information. So what it does, just to confirm, what we see is if we see a positive in the schools, we immediately notify the school nursing coordinator who is in our COVID liaison. From there, they notify the specific school nurse who then pulls the child's seating chart and schedules, gathers the information there, looks to see if there were any points of contact, and then they give us the names for the contact tracing as well so that we can get to the contacts and get them tested. So if you get a phone, if there was a case in the schools, the nurses gather that information for us so that we can do the proper contact tracing correctly. And then there's, we also have CTC following up on some of them in case we have language barriers, bandwidth issues and things like that. So the State Contact Tracing Collaborative is helping there. We reached out to CTC today, actually, in our office so that we can make sure that they're still on top of it, so that we're not getting a lot of the anecdotal conversations about how they're being slow. So we're trying to get the information on how on top of it they are. But yeah, the school nurses are helping on gathering that information for us.
Thank you.
The good news is the way the schools are set up and the processes are all set up there, as long as those protocols are being paid attention to and the teachers and the administration have been really good to pay attention, there's nothing that would be considered an exposure. So even though we've had cases in the schools, there's no reason to believe that the exposures happened at the school, from what the information we're gathering shows.
Are there any other questions before we move on to Jericho? Matt?
The first one I think is Gary. You had a chart that had contacts isolated at home. Is that positive, people who have tested positive and close contacts, or is it just people who have tested positive?
My understanding is that's anybody that we would have contacted through contact tracing or that's positive that would have been asked to isolate. So a total number, an aggregate of what's impacted.
All right, because so that's the total number. So you guys track who that is? Do you know, is it kept anywhere? I don't need to know the names, but is it kept anywhere with, who it is, and so you have an idea?
It is. Yep. And what we do is we follow up with those individuals, and we know when they're coming off the list or how they're doing, so it's tracked.
I have had people, and Mary talked about this, Mary Leppery at the Board of Health meeting. I've had the same conversations with people who have been close contacts and have never been, guaranteed close contacts and not ever contacted. So it isn't anecdotal. It might be anecdotal or secondhand, but when people who are, coaching a soccer team or doing, or with clearly have been in contact with people, some of them have not been called at all. And I know that there's I know we're doing our best, but there is a gap. And I think people have heard, have experienced that. So I think when we call it anecdotal, we're acting like it's not true. For the people who have, who it's happened to, it is 100% the case. They've had a close contact, they know it, and nobody ever called them. There was one incident where someone was called and the person that contacted him, probably from off island, said, "Hey, we'll call you back later." And the call never came. So I don't know if there's a protocol where after a certain number of days, they stop contacting people, or if they're too busy, they put us down because someone is more important. I have no idea, but there is that, I think it's important for people to realize that conversation is happening in the community.
Yeah, Matt, I'll address it this way, in that, we work in partnership with the State Department of Health to ensure that resources can be available for contact tracing. Roberto has the resources. But I'll also tell you that many of these conversations, I'm not going to say they're anecdotal, and they're not, but they're, contact tracing is only as good as what people are going to tell us so we can trace. And there's a lot of information that people don't talk about. They don't want to be named, or they don't want to name their friends. But I would encourage those people that know they're positive to call their friends and tell them that they are, and ask them to be seen or evaluated so that, we can understand that might be point that we need to follow up on, or the state contact tracers do. So there's high variability in what you're hearing related to who's actually been identified by an individual that's positive to a contact tracer so they can be traced, or they know an individual has an association with somebody and they know they've been near somebody, but they haven't been contacted by a contact tracer. That's going to happen unless we can have people, really step up and talk about who they've been with.
And furthermore, if you know you're a contact, quarantine.
Yep. And
Don't wait for the phone call. Don't wait for the contact tracing phone call. Don't wait. If you might be missed, quarantine. If you know you're a contact, quarantine, stay home.
And I think some people do that and some don't. And I read today 70% of the people that were contacted in New Jersey were not we're not answering the phone. We're not doing what they're supposed to do.
Right.
That was New Jersey, but that's the other issue is people being able to get tests. I know some people who had close contact and wanted to get a test. And this weekend they were showing up at 5, 6 in the morning and they were not unable to get tested. You guys ran out of tests. So one question I had is there, are the two lines, is there a symptomatic line and an asymptomatic line? So if people show up early to get tested, is it in two different lines?
There's two lines and we assess symptoms and asymptomatic, and we try to steer it towards the lines as we have the providers come in to open those. The Stop the Spread is 75 tests. And what I would say is that, there's a finite limit of space and tests available. If you show up and you can't get tested, then go home and quarantine and continue trying. What is really impressive about this island is that we have testing available. We're not a testing desert. And we are working to try to create another stream of testing capability that's offsite. And I think that probably either Monday or a week from Monday, we'll be able to talk about what that would look like to open up some additional capacity. But that's the component of overwhelming the hospital that we've been worried about. There's just not enough to go around for everybody that thinks they need one. And there are people that are upset on occasion that come and they want to be tested. They can't make the Stop the Spread. They don't have symptoms. We do ask people about their criteria for exposure, and some folks are sent back home or to the workplace because they just haven't met the criteria for testing, and they're eligible for the Stop the Spread testing the next day if they can get in.
Yeah, and real quick, Gary read my mind. I was going to ask if we could set up another location, so you beat me to the punch on that one. That was good. And then the other thing, just a general observation for the board after after watching the Board of Health the other day, is I think, and you remind us of this all the time, Gary, the hospital is in the treatment, in the care business. The Board of Health, the Board of Health is in the prevention business. And sometimes I think in the midst of this, we've sort of forgotten our roles and got a little jumbled at times. So I thought that was just something that kind of jumped out at me watching the meeting the other day that I thought was important to remind us.
Thanks, Matt. Should we move to Jericho?
Madam Chair, sure. But just before we do that, I just wanted to mention what Jericho is going to be talking about. It was in the email I sent to the board on either Friday or Saturday. I can't even remember which day it was, but we've been working internally on the establishment of a staff task force, a COVID response task force. The most important part of the task force is that it will be related to enforcement. So a couple things about it. We are working on, have worked on, and have drafted an emergency order for the Board of Health to adopt. It's basically a resolution to establish this task force, and it authorizes the different staff members to enforce the local orders. They would also be enforcing the state orders. Basically, I'm just going to read you a little bit of what the task force would do. It would be the goal to increase the ability to detect possible sources of spread, educate residents and visitors on the importance of complying with emergency orders, guidance, and directives, and to initiate enforcement action where necessary, including the assessment of fines to violators. So we've met with the task force. They are working now. Jericho is going to give you a brief update. And we're going to be, we have the task force group members, and then a group of department heads that are sort of, that the task force reports to. So we are meeting once a week with the task force. And this is going to be active until the positive cases are at a more acceptable level or no level. Jericho?
So yes, I'm starting up the task force, which is how I'm going to refer to it for the rest of this particular presentation. We're currently about 5 members. We're going to be roping more people in. We have members from all of the major departments involved with this: fire, health, police, as well as other departments which are currently able to provide us information on where we need to be focusing our efforts. It's going to be a combination of enforcement and outreach. I don't believe this particular problem can be solved entirely through enforcement, so I'm going to be trying to pair additional education and kind of universal application of guidelines, as well as making sure that we have suitably served the linguistic needs of the community to make sure that everybody's on the same page in terms of what needs to be done and the best practices to do that. At the moment, we're establishing communication systems and getting a record-keeping system together so that we can keep track of what's going on. We can report back to the oversight board, and we can report to the general populace as to what we're doing, when we're doing it, and to a large extent, like where it's happening and that sort of thing. We're going to serve as an adjunct and parallel group. So we're going to take advantage of a lot of the existing resources that are already being used for enforcement, but we're going to be a kind of parallel and distinct group so that we can kind of coordinate with everybody who's doing it, because there's some duplication of services. If we have a single point to pass all this data through, it'll be significantly more effective. Additionally, we're going to try and have more than just the community, more than just the department heads. I want to have some community involvement. I've spoken in a few meetings and listened to a few people who have legitimate concerns and will be able to give us a great deal of advice. I am also planning on proposing some anonymous information thing. We're going to have some publication on different requirements that are necessary in order to be COVID safe, more or less. And then we'll also be doing regular patrols. We'll be doing targeted sweeps, more or less, although that's a bit more pejorative than it really sounds. It's less pejorative than it sounds. And then we're going to be really tightly connecting the recording and the sharing of best practices and how COVID is spreading, and making sure we coordinate very tightly with health, fire, and PO.
Any questions on that? Christy, then Matt?
Will this task force also be a source of information? So if people have questions, they could contact and get answers.
I'm looking to coordinate very closely with our social media and public outreach departments, and I am attempting to set up a system by which we can field outside inquiries about information. We also have to be very careful about how we manage our information or how we share our information for a variety of different reasons, but I absolutely expect to have an element of this task force open to the outside populace.
Matt, then Gary?
Yeah, it's great to see that we're doing this, and I thank everyone. And it's good to see that we're going to reach out to others. I think there's some people in the community, summer people, island people, who may really be able to help us. That's great. And I think this is a step in the right direction. It might have been to Libya, I'm not sure. I look at this kind of, like the health department does for restaurants. If we just said, well, we're going to go to 1 or 2 restaurants a year and they all know the book and they read the book, it's up to them, we would have a lot of non-compliance in restaurants. There's a lot of work that goes into making sure the restaurants have, are wearing their hair nets and are, have temperatures and are right, and all the little things. And we get 1, 2, 3 inspections a year to keep, the 100+ restaurants on track. And so I think this is the type of thing, and it isn't all that punitive. Very rarely do they fine anybody, but they do a lot of correction and a lot of contact to gain compliance. And I think what we've been missing as a community is a way to know what we're going to do when to improve compliance. And I think this has been a missing piece, and it's hopefully a step toward compliance. We've been mixing up, education with compliance. You need to do more than just, be at a keyboard and tell people. You have to have boots on the ground and do it. And I'm really glad to see we are doing it.
If I may. So
Yeah.
I think that compliance is a huge issue here, but there's a significant number of different ways to ensure compliance. I want to make sure that everything that we do, because you do need both, the carrot and the stick. I want to focus as much on the carrot as I do on the stick. I do think there is a need for more visible and more regular enforcement actions, and that's a big chunk of what we're doing with this particular task force. The regular, consistent shows of interest by the Board of Health, by the town, is going to go a long way to get compliance. But another huge portion of compliance is simply buy-in from the people who are most at risk, which is something that we have definitely been we've definitely had trouble getting that flow together, as best I understand it. I'm hoping to kind of focus on that as much as I am on the enforcement. And I'm also really looking forward to getting more kind of community involvement in this particular element.
Gary Shaw.
Yep, thank you. I just want to share one last graph that just came in that kind of superimposes what I've been talking about related to total number of people that are, where did it go? Let me do that one more time. I'm not as good as Roberto at this, but I think somehow I just deleted that graph. So if you will just give me 1 second, I'm going to reload it and show it. Roberto, do you have the graph in front of you that I sent?
No, there was nothing on the email.
Okay,
It's
here we
not
go. Let me open this up. Okay,
Okay.
go back out here to this, and
If you forward it to me again, I can probably.
no, I believe I can open that now. Okay, there we go. All right, can you see that?
Yes.
So this just illustrates, where we are any particular day with cases or new cases. And when you look at the 26 over here, you can see our positivity rate. But we've got 26 new cases, and collectively we have 217 people in quarantine in the community. Okay, that's the worry is, will we stay in quarantine, and how many of those people will start moving towards more severe illness. So as we look at any measures that we take in the community, it is let's isolate and let's wear masks and let's hand wash. That's so important with this kind of high numbers. That's all I wanted to point out.
Christy.
Thank you. Gary, with that many people in isolation, can you just review some of the services or ways the hospital is helping people stay isolated so that they can protect our community?
Well, we've worked with the Interfaith Council so that we have contacts with the churches going out to individuals that are needing help and assistance. I know that there's fuel assistance, there's some housing assistance money through different foundations that we make people aware of. With people that are positive, or the test, we hand out packages that give information in multi-languages on how to stay isolated and protect yourself. We've given out thousands of care kits that have in it masks and hand sanitizer, and the list goes on. And each time we see a different type of jump, we double down and try to revisit that to see if we need to improve some level of effectiveness. Roberto, anything else I'm missing on those points?
We also, when there's a positive, lately with the 130 something cases, we haven't been able to do it this week, but usually when there's positive cases, we are also able to drop off information at the household of the positive cases as well, with information on the Nantucket grocery delivery group and fuel and rental assistance and things like that in multiple languages.
Jericho?
Yeah, we also, in coordination with Roberto, we're actually sort of, as part of this task force, expanding that element of it as well and trying to get better communication directly through with people. There's also some discussions about getting sort of survival kits for quarantines that we're batting around.
And Christy, we point everybody towards our website for information in multiple languages and, how to understand the illness and deal with it. So I think that we have gone probably in cycles of 7 days looking at this and seeing how we can improve and constantly adjusting just based on the circumstances.
Anybody else have any questions? Any members of the public? Matt?
Just a comment. I will say the need, if people are thinking of helping the food pantry, I know we deliver bread there. They pick up bread a couple times a week. It's 3 or 4 times as much as they were getting 3 weeks ago. So, so the need is out there. People are, people are struggling. And if people have the ability to donate to the food pantry or to some of these other, some of the other people who are helping, it is something you should do. It's, it is a real need. It is out in our community right now. And that's particularly hard at this time of year. So if people can do it, it would be great.
Thank you, Matt. Very true. Libby?
I just wasn't sure if you were done with the items that are actually listed on the agenda, because I had a couple of additional bits of information, but not on every single thing.
No, go.
So, okay, enforcement we just discussed. Christmas holiday guidance, I don't think we totally have yet, but I think it's everything that Gary and Roberto and everybody else was saying. Do not travel. Do not gather. Wear face coverings, all of that. At the governor's press conference yesterday, every state official that spoke yesterday, the governor, lieutenant governor, public health commissioner, and the other gentleman there whose position I can't remember, they all said the same thing emphatically. And if people don't know those things by now, I don't know what to say. Board of Health orders, we don't really have anything new on that, although I did mention this sort of resolution that the Board of Health hopefully will adopt on Friday about the task force. The town administration public outreach update, we're doing a lot with public outreach. We have a list online of all the various things we've done with signs and flyers and t-shirts and videos and all manner of social media. We, you all talked a little bit about when Roberto mentioned pods and the need to, stay in your own pod and what is a pod. And we did develop a graphic for that. I don't know if Eric, if you have that handy. I just wanted to quickly show it because we're going to be pushing it out. Great. So this is what we've come up with. And Roberto, I don't know if you want to maybe elaborate on this a bit. Everybody's household is their pod. And, for some things you have to go outside your pod, but don't linger there. I think is the message basically, right? Or do you want to say anything more about pods?
Well, it's just a graphical representation of the intersectionality of how all the pods interact with each other. So as soon as you exit your home and you go to any one of these locations or any other location for that matter, you are now expanding what your pod or your group actually is or means. So we're trying to really do a good graphic representation of that.
Thank you. Thank you very much. There was new information this week, as we already mentioned, about the rollback of the reopening plan from phase 3, step 2 to step 1, which we are already at, and it wasn't total big change for us, but we're getting out information on that. The isolation and quarantine guidance was modified a little bit the other day by CDC, which we're working on that. Also translations, the town website offers translations. People can basically read the pages in any language they wish. It's readily available online. We have a handout. We have actually a handout and a lot of graphics for the construction and landscaping folks, because some of those people are non-English speaking. So we're really trying to get the word out about the safety measures there. So lots of things going on with public outreach. Over the weekend, just so everybody knows as well, the EOC met on Saturday. The hospital's incident command met on Saturday. Was that Saturday? And then BOH met on Sunday. EOC is going to be meeting weekly for a while, I guess, until we can get things calmed down a bit. And so there's a lot of activity at the town level to try to deal with this. That was it.
Thank you, Libby. Does anybody have any final COVID comments tonight? Oh, Matt?
Yeah, just one more. Someone reached out to me today, and this is a Vito Capizzo quote. He said, prepare and do your work in the first half so you can enjoy the second half. And I think that's how we should be thinking about, what we're up against. I think that we should do our work now so that when we start to have vaccines and we start to get into spring, we are back where we were last spring, and we can have, as normal a summer as possible. And so I think people need to take a deep breath and realize we have some hard work to do over the next, 2 or 3 months, but there's an end in sight, and we're doing it for the right reason. So.
Melissa?
Thank you, Donna. I'd like to just echo what Matt just said with my Chamber of Commerce hat on. I think if our community can really band together and take safety precautions as best as possible over these next 2 to 3 months to really take heed to the rule that our pod is our home, who we live with, not outside of that, then our businesses, which is a reminder, are our friends and our neighbors, have the greatest chance of economic success. And we all have the chance for social enjoyment as we move into the spring and summer. And I think that's what we all want, is a healthy, functioning economy and to be able to be with our friends and neighbors socially again. And so I can't more strongly encourage everyone to heed that advice.
Thank you, everyone. I'm going to move into public comment for anything that is not COVID-19 related and is otherwise not on our agenda for discussion this evening. This is the time when anyone can bring something to our attention. It won't necessarily be something we would address tonight, but this is open public comment. I do not see any hands. No new business that I'm aware of. I will move to approval of minutes from December 2nd.
Move approval.
Second.
Second. All those in favor by roll call: Christy Ferrantella,
Aye.
Matt Fee,
Aye.
Jason Bridges,
Aye.
Melissa Murphy.
Aye.
Thank you. Don Holgate, aye. Unanimous. Approval of treasury warrants for December 9th.
So moved.
Is there-
Second.
all those in favor by roll call: Christy Ferrantella,
Aye.
Matt Fee,
Aye.
Jason Bridges,
Aye.
Melissa Murphy.
Aye.
Don Holgate, aye. Carries unanimously. Then we do have an appointment this evening. We have a Roads and Right-of-Ways Committee vacancy. We've talked about this at the last couple of meetings, announcing it. We have one applicant, Phil Smith, who's with us this evening. Phil, if you would like to say anything, we would be happy to hear from you. I see you turned on your camera.
Yeah, you didn't want to see me for the whole last hour, but no, I've known Alan Reinhardt for many years, and he and I were talking, and I mentioned that we now, the last couple of years, are residents of the island, and he asked if I'd like to get a little bit more involved, and I am a bit involved already, but not from a town point of view, and I thought this might be something where I might be able to help out.
Well, thank you for volunteering. We appreciate it. This is an uncontested appointment. So does someone just want to make a motion?
I'd
So
like to
moved.
make a motion. Yes, second.
All those in favor by roll call, Christy Ferrantella,
Aye.
Matt Fee,
Aye.
Jason Bridges,
Aye.
Melissa Murphy,
Aye.
John Holgate, aye. Carries unanimously. And Phil, we look forward to working with you.
Thank you. I'm certainly learning some new roads and ways in the island that I didn't know existed before.
Great.
So I look forward to it.
Good luck with everything. Thanks for being here tonight. Appreciate it.
Thank you.
Next, we have a public hearing to determine the tax allocation by classification percentage of residential exemption to be granted for fiscal year 2021. This is continued over from December 2nd. We have Rob Branney with us this evening. And Brian Turbot.
Madam Chair, I think that I'm gonna, Rob will fill in if I misspeak on anything.
Okay.
We actually need to request a postponement because we had expected DOR to have certified our new growth by today, and up until about 2 hours ago, we thought it was going to be done. They have some additional questions just because we do have a fairly substantial amount of growth due to the building boom that still continues on the island that we have captured. And they advised us when we had discussed the possibility of making the recommendations to you today that we really need that to be approved before we can have you make the recommendations.
Okay, so when do you want us to continue it to? We have to do a date certain.
I think Monday would have to be the date. It's supposed to be done tomorrow, but we are running really quickly into a deadline to get the files. So I think Monday is the earliest that I would feel comfortable with, given some of the questions that we have to answer.
Brian,
Yep.
if I might, through the chair, what was the problem with next Wednesday again?
We have to have the file, depending on what time we did it, I guess, Libby, it might be okay, but we have to have the file to the printer by next Wednesday.
Okay,
And we'd have to have DOR be able to certify it on that date and input the rate into the file. So it might be doable depending on the time that we did it. If we could do it earlier in the day, Wednesday, that would be fine.
Libby, could you do it in your open session on Tuesday, the 15th?
we could.
That might work.
I'm just, instead of scheduling a whole nother meeting, I don't
That's
know.
fine. I didn't realize there was an open session on Tuesday. I'm sorry for that.
Well, you wouldn't know about it
Executive, but
because it's meant to go right into executive.
Okay.
If we think this can be, I mean, you all tell us, if we think this is a pretty quick vote, yes, we could do it.
I can tell you that I think that my discussions with the assessor are going to be that there's not any, we're going to present a couple options, but our recommendation is going to be that we make no changes to the shift of the residential exemption from what it was in 2020, partially due to the fact that next year we expect more substantial changes that may be able to be dealt with either through the shift or through the residential exemption changing. And Rob can correct me if I'm wrong in that part of the discussions that we've had, but I'm fairly confident that that is correct.
I wonder if we could try to do the open session at 3:30. Would that work, Erica?
Does that work time
Yeah.
wise?
we can push it back.
Work for the board, or at least three of us?
So we do open session at 3:30 and keep executive at 4.
Yeah. if that
I'll
works.
make that change.
Okay, so can someone make a motion to continue the public hearing to
So moved.
Tuesday at 3:30?
So moved.
Is there a
Second.
second?
Second.
All those in favor by roll call, Christy Ferrantella,
Aye.
Matt Fee,
Aye.
Jason Bridges,
Aye.
Melissa Murphy,
Aye.
John Holgate, aye. Thank you.
Thank you very much.
Thanks. We'll see you
Thank you
on
all.
Tuesday. Thanks, Rob. Town managers report. Libby, you want to take us through?
Okay, yeah. So first off, we have our 2020 annual employee years of service recognition. So normally, in a normal year, we would have had an Employee Appreciation Day, most likely in November. And that has been a really fun event. We've been having it at the VFW lately. Some of the board members attend and everybody has a nice time. There's some activities, food and drink, a lot of we have had a dessert contest. And it's been really fun. And we hand out the years of service pins and we go through the list of people. But we couldn't do that this year. So we're going to do it here at the meeting. And I'm going to go through the years of service. And at some point, probably in January, I will get around to the departments to issue the pins in a physically distanced space covering manner. So I'm going to start with, I'm going to start low and go high of number of and build up to the highest years of service for 2020 so far. So we have a group of employees who have been with the town for 5 years, and I am going to go by department for them. So 5-year employees, we have 3 in DPW, Ryan Clark, Tony Grant, and Aaron Kane. And they are all very friendly and we see them around often. So thank you for your service. We have 1 firefighter, Kevin Ramus, 5 years. Thank you, Kevin. We've got 2 people in public health, John Hedden, health inspector, and Roberto Santamaria, our public health director. Congratulations, Roberto. Thank you for still being here. Okay, and then at our island home, we have Aaron Riley. He works in maintenance. We have a couple of people in Plus, Holly Backus and Jim Barry. We have several people in the police department, Amy Baxter, our licensing administrator, Patrick Considine, he is a dispatcher, and let's see here, Michael Mastriano, Mike, police officer, and Amanda Schwenk, police officer. In the sewer department, we have 2 5-year people, Phil Allen and Laura Cabati. Thank you, guys. And in town administration, we have our beloved Katie Cabral. She's our office manager. So that is 5-year people. 10-year people, moving up, we have 2 of them. One is in sewer, Sean Mooney, and the other is Assistant Town Manager Greg Tiffnin. I know you're watching, Greg. Congratulations and thank you. We have 15-year employees. We have 8 15-year employees, and those are Corey Ray, a firefighter. We have Ginny Carrera from Health and Human Services, Nate Porter and Molly Sprouse from IT, Nancy Coyle at our island home, a couple more people from police, Janine McMullen and Brett Morneau. You might know Janine more as Janine Malden, but now it's McMullen. And one last person, Gail Holgate, who currently works in the town clerk's office. So thank you all, 15 years, that's very significant. And then we've got 10 20-year people. We have 3 people at the airport, Gary Allen, Blaine Buckley, and Kirby Fowler. We have Mark Voigt, Deputy DPW Director for Facilities. We have another firefighter, Jeff Allen. We have a few people from our island home, Nadine Hay, Fernella Phillips, and Stormy Reed. I have been at the island home to issue pins and various awards, and Fernella is quite a singer, FYI. If you get a chance to have her sing to you, it's really a treat. At sewer, we have Paul Boucher, 20 years. And lastly, Robert Earl from the water company, 20 years. 3 people are 25-year employees. We have Ray Sylvia from DPW, who is our fantastic sign person. We have Carol Matson from our island home. Thank you, Carol. And we have Jerry Mack from the police department. And Jerry is our new downtown police officer. He's out and about all the time. He's very responsive, and we're really glad to have him downtown. Moving to 30-year employees, we have 3 of those. 2 of them are in the DPW, so I want to focus on them for a moment. Sometimes these 2 might seem a little bit gruff, but actually they're not. And they are very dedicated, very hardworking, and hilarious if you get to talk to them. Nikki Duarte, 30 years, and Dale Gary, our arborist, 30 years. Congratulations to you both. And our third 30-year person is Sandra Beirut from our island home. Thank you, Sandra. Last, we have 2 35-year employees. These 2 people have worked in the police department for 35 years, and they even were married not while they were working, but while they worked for the police department, they became married. You follow. So very much congratulations to Sheila Klinger and Tom Klinger. Very much appreciate your service to the town. So congratulations to everybody who has achieved these milestones. Your work and service is very much appreciated, especially in these really hard, challenging times. We appreciate it so much. And hopefully next year we'll be back at the VFW for a real Employee Appreciation Day. I hope I didn't miss anybody. I will certainly hear about it if I did. So thank you, everybody.
Thank
Okay.
you. Those are some great achievements.
Definitely. All right. My next item is the budget for fiscal 22. This is the general fund budget. This is a presentation that Brian and I will both do. In your packet, there is a PowerPoint. There's also a draft budget message that I'll go over at the end. So section 4.2D3 of the town charter requires the town manager to prepare and submit to the select board an annual operating budget. So we do this, annually, right around this time of year. As I said, this is the PowerPoint, and there's also a draft budget message in your package. It's draft basically until we get a little further into the process, and then we'll make it final and post it online. The draft budget message is a pretty long document. It is the document that explains the recommendations, projections, and various issues in detail. So that's a document for people to really read through. We do have a list of the requested expense increase requests from department. It's not in your packet for tonight, but it can be provided if the board would like to see it. So our intent for tonight is to take the board through this PowerPoint. It contains an overview of updated projections, our recommendations, and next steps. The detail is contained in the budget message, which I just mentioned, and we will just take you quickly through that, not reading it, but just show you what it looks like at the end of the PowerPoint. Our fiscal 22 general fund budget development process began with a review of preliminary projected expenses and revenues with the Finance Committee on September 21st, the board on September 23rd, issuance of budget instructions to the departments on September 25th, and review of every general fund departmental budget from mid-October through November. Along the way, we take in, seek out, review, and analyze new or additional information that is brought to our attention or that we are monitoring. Sorry, that was supposed to all stay on slide 1, but it's okay. I didn't make that clear. So slide 2, I'm sorry, go back. Yeah, thank you. Sorry about that. Fiscal 22 budget objectives are listed here. Obviously, we want to keep the budget within projected revenue and have a balanced budget. We want to address priorities that are in the board strategic plan. We do have some new things this year, which are to address emerging PFAS issues, continued response to COVID-19. And we always try to maintain some flexibility with the levy limit and the use of free cash within the budget. We're basically trying not to spend all the revenue that we have because we really need some flexibility this year more than ever. Next slide. Thank you. Okay. Initiatives specific to the board strategic plan that are recommended in the fiscal 22 budget and or are ongoing are shown on this slide. I won't go through every single one of them here. You can see them. COVID response and budgetary and PFAS are shown on slide 4. Sorry, here we go. These are just some specifics that we have contained in the budget on those two issues. Initiatives and opportunities undertaken during 21 and into 22. These are either underway already or will be continuing into fiscal 22 and or will be budgeted for fiscal 22. So I just want to spend a second going through some of these. I think you all are familiar with all of them. Our Island Home operations and facility review. We have some stakeholder meetings coming up in January to review a list of things we've come up with over the fall as to what priorities are important with Island Home in order to plan what our next steps are for that facility. Something very similar with Senior Center operations and facility review, and that is concurrent and a little bit integrated with the Island Home discussion. Parks and Recreation and Community School, we have started a little bit of a discussion with the community school about the potential for perhaps a merger. We don't have a Park and Rec department standalone anymore, but there are a lot of things that the community school does now that if we had a Park and Recreation department, they would be doing. So we don't want to duplicate efforts. We want to take advantage of an infrastructure that's already in place. And the community school, I think, could use no offense to the school, but the school is now very much focused on COVID, the curriculum, they have space issues, and they have security issues. And where the community school was appropriate to be part of the school department back when it was initially established, it may be time to revisit that. So we are having those discussions. The PFAS townwide risk assessment you know about because we had a workshop meeting yesterday with the Board of Health. The Coastal Resilience Plan is underway. You know about that. The Hazard Mitigation Plan is in place, and we are putting the projects from the Hazard Mitigation Plan into our capital improvement plan. We are working to co-locate public health and natural resources at 131 Pleasant Street. COVID-19 response and follow-up we talk about every week, so you're familiar with that. The diversity, equity, and inclusion initiatives, I think you are all familiar with, and I think Ms. Murphy may have a brief update about that at the end of the meeting. The municipal facilities master plan, you all had a workshop about this several weeks ago, and there's another one in, I think, January to further this discussion, which is also a goal in the strategic plan. And the sustainability office and associated projects. Well, the sustainability office is an ongoing project in and of itself to determine how we are going to establish that within the town. And we have some funding set aside for it in the fiscal 22 budget. And we have these solar projects that are underway, which I think you all know about. Okay, efforts to reduce expenses and increase transparency and efficiency. These items are listed here. These are things that we do on a routine basis. And while COVID-19 has presented, we all know, numerous challenges, there may actually be some potential benefits that could be realized, which we hope to explore further going forward. For example, more items online that people could access online rather than coming into an office. There may be remote work successes that we would want to continue. And then there's a couple of other things listed there involving the PEG channel and COVID-related grant opportunities. Brian, I think you are going to take us through the next several slides.
That is correct. Thank you. So for fiscal 22, we're projecting that we would be able to raise through real and personal property taxes, state aid, use of free cash, and local estimated receipts, $111,382,000. The recommendation from town administration is a projected expenses of $110,746,000. This would leave projected unused levy capacity of $635,000, and I think we'll talk about this in at least more than one of the slides in the presentation. We're currently recommending leaving this amount of unused levy capacity because as solid waste expenses continue to rise, we may need to use some of this unused levy capacity as additional funding source on top of the subsidies that they do receive. And we're currently going through budget reviews with the enterprise funds, and there's a possibility that they may need additional amount of subsidy from the town to cover any operational increase based on the anticipated continued usage of the facility. So that's why currently we have a projected unused levy capacity of $635,000. Next slide, Erica. On this slide here, it compares the fiscal 21 approved budget recommendations that were approved at the June 25th, 2020 town meeting with the recommendations from town administration. You'll see that the property tax is 91.8 million. Local estimated receipts not identified there is 2.3 million. Motor vehicle excise taxes, we're estimating 2.2 million. Rooms and meals, you'll see a substantial increase to 4.8 million. Approximately $4.5 million of that is associated with the rooms tax, given the how busy the island was this summer. We are being somewhat cautious, though, that is not going as far as we may be able to go in the budgeting for rooms tax, just because we're not entirely sure what next year may look like, but we're confident that we will reach in that number 4.5 million. Licenses and permits, we are seeing an uptick in the amount of filing fees for permits, so we're projecting an increase there for next year. State aid, you'll see a substantial increase from what we had recommended or anticipated for fiscal 21 in 22. The conference committee has recommended, and the legislature recommended very early in COVID, that we actually level fund for fiscal 2021 state aid at the prior fiscal year of 2020's budget. So we are carrying that forward because that has been the recommendation for the fiscal 21 budget. So we're confident at this point that we don't believe there'll be any changes for fiscal 22. Free cash of $4,575,000 funded for various initiatives that we will go through in the free cash slide. On the expenditure side, a total of $33.5 million for municipal departments, $33.4 million for school department, non-departmental, which is debt service, health insurance, regular insurances, retirement of $29.9 million, and special appropriations of 13.7, which is the reserve fund, OPEB, and our subsidies to CRC, as well as the subsidies to the enterprise funds. Next slide, please, Erica. This slide, which we do normally present to the board, shows, as typical of many communities across the Commonwealth, the real and personal property tax revenue makes up 86% of the revenue that we collect. Rooms and meals is the next highest at 5%, with state aid coming in at 4%. Next slide, Erica. We try to show roughly what all of the departments, being municipal, school, non-departmental, and special appropriations, what percentage of the budget they are. And here you can see the school and the town are roughly similar. Special appropriations is 12.4 and non-departmental is 27.1% of the operating budget that's recommended. Next slide. So I'll take you through a breakdown of what is in that 110 million. We're recommending operational expenses of $8.8 million. That does include $1,361,000 of operational expense increase requests that we will take you through in a subsequent slide. We're proposing and recommending $21,645,000 in salaries to operate in the town. It does include $604,000 of expense increase requests for new positions that have been recommended by town administration. We're recommending, in consultation with the school, $5,536,000 in operational expenses, which does include some EIRs in the amount of $225,000 and school salaries of $27,340,000. Next slide. Thanks, Erica. Health insurance, which we have started breaking out between active and retirees, we're recommending $10,528,000 for active employees, $3,792,000 for retirees. You'll notice that is a 7% increase over the prior year. The actual rate is actually projected potentially to rise by 10%. However, due to changes in people switching plans or leaving and not using the town's insurance any longer, the actual dollar increase in the budget is just over 7%. General insurance is projected to rise by 18% to $3,108,000. This primarily is a result of the very, very busy hurricane season in the Atlantic, which was the costliest on record, or seventh costliest on record. And we are certainly bearing the risk associated with being in the middle of the ocean when it comes to projected increases and So our advisors have our general insurance advisors have advised us that 18% is most likely where it's going to fall. We will certainly, as we do, work extremely hard to reduce that in any way we can. Debt service of $10,008,000. Retirement projected to increase by 8.5% to $5.6 million. That's based on the funding schedule that PARAC approved for Barnstable County, which has us fully funded by 2038. Enterprise fund subsidies of $10,002,000, which is a 1.1% increase over the prior year. Next slide. Thank you, Erica. No change to the recommended funding from the prior year of $650,000 for Health and Human Services. County assessment, there's a very small change of about 2.5% from $170,000 to $174,000. No change in the recommendation to the reserve fund. No change in the amount of unpaid bills. We certainly hope that'll be less, and as of right now, I haven't seen very many. Other post-employment benefits, last year, if you recall, we did remove that from the fiscal 21 appropriation at the annual town meeting. We're recommending restarting that contribution, and we are recommending the $500,000 as we had done in the past. We do not expect any overlay or any other deficits that we'd require to raise. Cherry sheet charges, this is the conference committee's number of $984,563, which is consistent with fiscal 21. And community school, no change in the recommendation of $550,000 to the school for that program. And then minimum capital funding as per the town code of $974,000 gives us the grand total of $110,746,000. Next slide. So expense increase requests, not including anything that the school may be using their appropriations for. $4,281,000 were submitted to town administration by all departments. We have been able to recommend $3,098,000, with $1,265,000 of those being one-time, and ongoing of $1,833,000. These would be funded through available tax levy, budget adjustments, any special revenue funds, and primarily as well as free cash. Next slide. This is the list of recommendations that will reconcile and tie out to the $3,098,553. Next slide.
Brian, back to me.
Oh, I'm sorry.
I think, you would, I was going to do 15, you were going to do 16, 17. So just a comment on this slide here. These are the recommended expense increase requests. We've been using criteria to evaluate the requests and base our recommendations on them. These include whether or not the item is a legal mandate, whether or not the item supports the strategic plan and or is recommended in the 2018 staffing study, whether it improves departmental operations, is it necessary to support approved new programming or existing programming, does it provide continuity of operations. Each request is ranked using a point system. The recommendations are shown on this slide. It is a little bit hard to read, but it'll be easier in the budget message. Overall, the recommendations include 9 new positions, 3 of which were in the original fiscal 21 proposed budget, but removed in the revised budget. 3 additional community service officer positions, which were also in the original budget, and additional lifeguard and or seasonal staff positions to support COVID beach protocols and other safety measures that are anticipated to continue through next summer. So that would be an expense that hopefully we would not have to keep up with after fiscal 22. Funding for strategic planning initiatives and facilitation is included in here, vehicle and equipment replacements. We do have a large item which totals about $400,000 for housing expenses related to potential COVID requirements for seasonal staff. We will not be able to have double rooms going forward next summer, most likely. That is what we are planning for. And that will mean we most likely will have to rent space that we're able to rent some space last summer, but that space will not be available this coming summer. We also have an item, $36,000, that would be for annual rental of transitional housing for departmental level positions, department head level positions when needed. We have additional funds for maintenance of municipal facilities infrastructure And some of those also were included in the original fiscal 21 proposed budget, but had to be removed at the 2020 annual town meeting. Brian?
Next, perfect. So this is how we propose to fund the EIR request of $3,098,000, tax levy and other general revenues, $1,338,000, free cash in the operating budget of $925,000. We will propose using a capital exclusion for the 2 vehicles in conjunction with the potential capital exclusion used for Article 10 in the annual town meeting warrant. Special revenue funds of $270,000, primarily being the beach revolver and the ferry embarkation fee to support the $40,000 for the 3 additional downtown officers and the additional lifeguards. And then borrowing of $500,000, which is strictly related to the ongoing PFAS work that we have that has been identified in the expense increase request. So all told, the funding sources bring us to the $3,098,000 that we have recommended for expense increase requests. Next slide, Erica. Thank you. As most people on the board are aware, our certified free cash for July 1st of 2020 was certified at $9,655,001. Proposed one-time EIRs on the town side of $925,000. One-time expense increase requests for the school of $150,000. Funding town and school capital request, the recommendation to Capcom is $4,992,000. Unpaid bills of $20,000. And this is a placeholder here of $3,500,000. I believe on the next slide, the town manager will address this. As we're all aware, last year we did recommend a override for our island home. It was approved at the ballot, but collectively we chose not to utilize that override approval and raise that money in the budget last year. So we funded the Ireland home with $3,500,000 of free cash and $1.5 million from their retained earnings. Given the fact that that will most likely, or is the recommendation again from town administration to move forward and with potential override of Ireland home to fund the transfer of the subsidy, we do have to have another funding source in the event that that override is not successful. So Ireland Home's retained earnings were certified at just a little over $2 million. So we have put a placeholder here of $3.5 million in the event that the override is not successful, and we would fund that with retained earnings and free cash again this year if the override were to move forward and it was not successful, leaving us an unallocated balance of free cash of $67,747 as of the date of these recommendations. I believe this is where I turn it back over to the town manager.
Yep, thank you. Thank you, Brian. Outstanding items and current unknowns are shown here. So beginning with our island home, for at least the past 5 years, we've been putting forward the concept of a targeted override for the island home so that it can have a dedicated permanent funding source. The board has had quite a bit of discussion already this year and in prior years about this. We are again recommending it to cover the general fund subsidy to our island home and to lessen or eliminate reliance on retained earnings. We also, I don't think we want to get deep into this right now because it gets a little complicated, but we still have not received the certified public expenditure for fiscal 21, Brian? Current fiscal year?
No, we have not received it as we normally do in fiscal 20. So okay. That has still not been received as of today.
State aid is always a concern. While the state has not, I think the budget remains on the governor's desk. I think as of the other day, I don't know if he signed it yet or not. If not, it hasn't been finalized for fiscal 21 yet. We believe it's most likely that it will be level funded. However, I wanted Brian to mention a potential looming issue about fiscal 22 state projections, revenue and budget.
So we are level funding state aid in 22 based on what we know to be happening in 21. The governor and his staff and legislature will be meeting, I believe, very shortly to try to determine what they believe the revenue picture will look like for fiscal 22. But one thing of note is that they're currently projecting approximately a $3 billion shortfall in fiscal 22, and they have already used just under 50% of the stabilization fund to balance fiscal 21's budget. So while we believe that they will maintain the commitment that they have made to the communities into 22, it is still, as of today, still somewhat of an unknown.
Thank you, Brian. Harbor Place remains an unknown at this point. None of the citizen warrant articles have been included in our recommendations, and while some of them come with specific dollars amount, others don't, but they will have a cost impact if approved, and we are still determining what potential costs those might all add up to. We've reviewed the possibility of an annual CPI increase across the board for town fees. And at best, though, that might generate an additional $50,000 to $100,000. However, we do need to be cautious about what the fee increases are for. They really need to be tied to documentable increases in town resources and or funding for particular services, not just because we need more revenue. And a CPI would probably be an acceptable increase, but we felt the timing of increases may not be appropriate right now. The Steamship Authority deficit, while resolved for fiscal 20 and hopefully will be resolved for fiscal 21, does remain a concern for both 21 and 22. We are hopeful that it will not be an issue. If it is, pursuant to the Steamship Authority enabling legislation, the town of Nantucket will be responsible for 35% of that deficit. The NRTA deficit is out there as well. We don't know what that may or may not be. If there is one in fiscal 21, again, we hope that it can be covered through other means, but it could be a potential issue. We are waiting to see about that. PFAS and COVID-19, both costs for both of these remain a high concern and also very much unknown. The DEI office was able to be funded in our current budget. However, there may be other costs associated with some of the work to be initiated. Review of town policies and programs, for example, that we may want to engage professional assistance for that could potentially require additional funding. We have these couple of things here: short-term rentals question mark and new growth, what we were calling the bubble burst. Short-term rentals brought in a lot of revenue in the first quarter, very end of fiscal 20, first quarter of fiscal 21. However, we feel very cautious about it because this simply was not a normal year. We have not yet seen a normal year of that revenue source. So we want to be very careful with how we allocate it and deal with it at this point and project it. The new growth bubble burst, it directly relates to the real estate market and new growth and real estate transactions and, the improvements that are made to properties which increase valuations. And I think we're saying bubble burst because we just do not know what is going to happen with that. A year ago, we were very concerned that there were potential signs of an economic downturn. I don't think people would say we're seeing that right this moment, but are we going to see it? We just don't know. There is the possibility of an airport deficit due to COVID-19 and or PFAS, more likely PFAS, but COVID-19 has certainly had an impact on air activity at the airport. So we're watching all of these things. The police reform bill, which is pending, does contain some provisions that could be costly to the town. And I have not had a chance to thoroughly review that. Potentially, for example, if accreditation becomes required, which it most likely will, we, again, most likely will not be able to have uncertified officers working for the police department. So that's basically the CSO program that we would have to determine how we are going to handle. There also could be an issue with reserve officers that are currently covering the airport. We would have to figure that out as well. And that could require additional positions. Impacts of the Coastal Resiliency Advisory Committee interim recommendation. As you all know, the group made a recommendation that the board adopted in August, and it relates to using certain standards basically for certain types of projects with respect to sea level rise and climate change, depending on where the projects are. And there may be current projects that are already approved that we don't think will be necessarily impacted by this recommendation, but going forward, until there's a full plan, there may be some projects that are impacted. So we haven't really evaluated that in full yet. Next slide. Future potential costs are contained here. And again, some of the ones from the prior slide are also future potential costs. The strategic plan, the staffing study, all are always a potential future cost. The commuter shuttle system, we were, again, talking about this about a year ago. A commuter shuttle system is not included in our fiscal 22 budget recommendation. We're always looking to up-year our 5-year operating forecast with the department so we can determine what they are looking at for the next 5 years for changes to their operations, staffing, whatever. The open space and recreation plan is underway now. That may or may not have potential future costs. The solid waste contract, as we all know, expires in 2025. That is being worked on now. What the options are for moving forward after that, that might be a cost. NRTA, year-round service modifications, and also seasonal service modifications. There are lots of demands for the NRTA to run routes elsewhere and add routes and have more frequency. Those are all future potential costs. Maybe that can be balanced out a little bit with some kind of modification to the year-round service. I think the service right now may be a bit down. I've asked the administrator for some ridership numbers, and I believe she emailed them to me today, but I have not had a chance to take a look yet. The sustainability office is something we know is at the forefront of some of the items in the board's strategic plan, and that will certainly be a potential, will be a future cost, not potential, if we go forward with that. PFAS, the coastal resiliency plan, and the master plan all are most likely to have costs associated with them. Next steps. So we gave you our presentations tonight. We're certainly willing to, not willing, will answer any questions that the board might have. This budget item is also on your agenda for next week. This is usually how this goes. We give the presentation tonight. You all may have some questions, but you're only just seeing it tonight for the first time. So if you have questions that come to you during the week, we schedule another item for next week. We're going to the school committee on January 5th. The board has a public hearing on January 6th. That's an annual public hearing about the budget. And then we would hope that you would endorse the recommended budget at that time, or with or without changes, so that it can get forwarded to the finance committee. We'll be meeting with that group mid-January through early March, and they will be reviewing general fund and the enterprise fund budgets and other financial appropriations. And of course, right now, the annual town meeting for 2021 is scheduled for April 5th. However, as we discussed last week, I think instead of this may change, we might want to change that to this will change. And I think we will have a discussion at your meeting next week to finalize a new date for that, as you all discussed last week. I wanted to, Erica, are you able to pull up the budget message? It's the other document.
I'm pulling it up now. Hold on.
Okay. I just wanted to show you all what it looks like, so you're just a little bit familiar. Okay, just go to the top. That is nice music that you have in the background.
Oh, sorry.
Okay. So this is our draft budget message. We usually do a photo. It's sort of meant to be symbolic, and we try to have a quote, which is also supposed to be a little bit symbolic. Go down a bit. So there's a table of contents. Just sort of scroll through a whole bunch of appendices. We have an introduction. Stop here for one second. Last year we had these, what we called the 3 C's: challenges, continuity, and caution. We have those again this year, and they're slightly modified, but a lot of the same issues are carrying forward. Just keep going down. So we talk about the challenges. Keep going. Got some charts. We got some prior messages from prior years to remind everybody what they were. Keep going. Yeah, that's just continues with challenges. We have continuity and fiscal strengths. We are very fiscally strong. We have a very good bond rating. Just keep going. I don't want to spend too much time on this. Thank you. Cautions, just a list of them. Overview of the general fund budget projections. This is a lot more detailed than what Brian just took you through. Keep going. More to expenses and revenues. We have a detailed explanation about our expense increase recommendations. And we just go, this is all going through the recommendations specifically. We have current and future year considerations, and we mentioned some of those tonight, but again, this is more detail of what we mean. And then just a conclusion. And so while we're on the concluding part, I would really thank the town departments and specifically Assistant Town Managers Greg Tivnan and Rachel Day, as well as Brian and Ali Penta, our budget analyst, for helping put this presentation, the message, and all of the work that goes into the budget together. It is a lot. So any questions we would be happy to answer.
You want to go first, Jason?
Go ahead, Dawn. Go ahead.
The things I jotted down were a couple of budgeting things, and maybe Brian can explain it. The rooms tax. I think we know that it's going to be quite a lot higher than that, than what you've projected. I think you've maybe you could share with us the number that we've seen to date, and because I know we've had some priority talks about what we might do with that additional revenue that's being realized from the short-term rental tax, which I actually think that this year will be a good baseline because it wasn't a normal rental year. A normal rental year would be better. And also free cash seems to keep coming in higher in terms of revenue every year. I'm just wondering why you budget quite a bit less, and I'm sure there's a method to that. The other thing I was kind of concerned about was the community school. Did they end up with a deficit this year because of having to cancel so many programs? And is there any issue there?
Sure. So I can take those one at a time for you. Rooms tax certainly came in substantially higher in the October 9th payment. It was for 4 months. So it was actually for June, July, August, and September. I think people already know, and that will be reported in January anyway. It came in at just over $5.6 million. The next payment is in December 31st, which I will remind everybody will only be for October and November because September has already been reported to us. And we are being cautious because I don't know what next year will look like. I think that a lot of it, some of the travel here may have been because we did a really great job during June, July, August, and September in managing COVID. And people may have thought that we were a relatively safe community and they could work from home here. And I don't know whether that will or will not be the case next year. So the recommendation that the town manager and I discussed was starting at 4.5 million in the budget and as a conservative basis, because the one thing that I don't want to have happen is it go in a completely opposite direction and we end up with a revenue deficit, or we end up with having to make dramatic cuts to an operating budget. Do I think that December payment may be fairly good for October and November? I do, but I also think that we're in a very uncertain climate with a pandemic going on. So I don't know what fiscal 22 will look like. It's certainly 21 was better than we had anticipated, but in making the recommendations to the manager, I try to be somewhat conservative to ensure that we don't end up on the wrong side of the number. So I do think, Madam Chair, that this may be a better baseline. I do agree with the town manager that I don't think we've seen the full effect, and we had expected to see the full effect probably in 21 of the short-term rentals because of the timing of the implementation. I I think this will give us a better idea of where it may go in the future, but I'm not quite as confident that what we see this year is an absolute full effect of what we'll see in the future years, just given the climate that we're in. The free cash actually was about $700,000 less than last year. And we've recommended, with the exception of Island Home, one of the things that is kind of driving not using it all maybe towards capital or whatnot is the fact that we do have to have some type of reserve in the event that the recommendation, if the board chooses to put one forward for an override, doesn't pass. We have to have a funding source to balance that budget. And Island Home does not have the retained earnings to balance a $5 million projected revenue shortfall. So we have to set aside in free cash this year the same amount. I've recommended setting aside the same amount as we did that we funded it last year of 3.5 million. Obviously, in future years, if the board does recommend the override and it is successful, that free cash would be able to be allocated to other priorities or initiatives consistent with the free cash policy that we adopted in 2016. Community school, I don't know. I haven't not had an in-depth conversation with Martin at the school. Would be my guess that the majority of those cancellations probably would be impacted in this fiscal year versus last year. But he has not come to me and said we're going to have a deficit at the community school at this point. But I can reach out and get more information on what they're thinking the operations at the community school will look like.
Thank you. Those are really helpful. I mean, I appreciate you wanting to be conservative on everything. I'm just, the one thing I am hoping for, that we can come up with a funding source for the Affordable Housing Trust Fund. And I know that we've talked significantly about that coming from the short-term rental tax additional revenue that's being generated. But Jason, you had a question?
Yeah, that was going to be my first question. So I have a clarifying question for Brian. So let's say we're conservative and we assume it's going to be 5 million for the rooms tax, ends up being 10. Where does that 5 go? Does it go into free cash? And second question is, if we are going to kind of be conservative, how do we set up? Does anything over that goes to housing and infrastructure as we originally planned for the STR?
Sure. So to answer your first question, whatever we budgeted local estimated receipts, if we collect more than that budget, okay, let's just say the total budget was 12 million and we collected 15 million, okay, in that particular, that all goes to the bottom line and would be certified as free cash available for appropriation after it's certified. So anything above the budget that we collect certainly does fall to free cash, okay. The town manager and I have had a couple discussions about this. What are the options? I mean, certainly there would be an option, I believe, under the statutes to do some type of special purpose stabilization fund where we would direct some percentage. I'm a little bit on the hesitant side to think about recommending that for these, because then when you try to take it out, it requires 2/3 majority to appropriate from that vehicle. And while I think that the community certainly does support affordable housing or water quality or whatever those may be specifically directed to, there always is a risk that we're not going to get 2/3 of the voters to necessarily agree with exactly what we want to do. So I think that there could be an opportunity, and I certainly would want to talk to the town manager about this much more in depth, but there could be a scenario where we use a baseline in the operating budget, and if we're comfortable budgeting a higher amount, we could make appropriations through a regular annual appropriation at town meeting. For that, I just, one of the concerns that I would have about using some other type of vehicle is if we dedicate a specific percentage and for some reason rooms tax craters in a year and comes in or projects to be far less than what we have, we're going to impact an operating budget in a different way than I think we all intend to. So I think there's ways to do it, Jason. I just think that we have to thoughtfully think through how to do it.
I'll go to you in 1 second, Christy. I just wanted to do a brief follow-up because we did talk about that a bit last week, I think, that the stabilization fund is too hard to be able to utilize. The idea is to get money into the trust fund so then they can be reactionary to the real estate market. And I think and the rest of the board can correct me if I'm wrong, but I think we're looking for most likely a line item in the general fund budget that puts a yearly funding into the Affordable Housing Trust Fund, whatever dollar figure that is, like we've done in the past. But I think it's time to bring that back.
Okay.
And I'll go over to Christy.
Thank you. You kind of took the words out of my mouth. I just wanted to make sure that we're thinking about affordable housing, and especially with it being on our strategic plan, and that $20 million is being used up pretty quickly by the Affordable Housing Trust. So I know that they're going to be looking for more funding. So I'd be happy to see something in our general fund line item that goes towards affordable housing.
Thanks, Christy. Matt, did you have your hand up?
Yeah, I was gonna basically mention what you did, Dawn. So you covered it. I think it's good that we're being conservative with the figures. I think that's the smart way to go. Of the island home, I'm hesitant on an override till we know what we're going to do where, and we've got that sort of figured out. And I've consistently said that for a number of years now. I'm worried, that we won't have that figured out. So, I would like, maybe what we could do is have the room tax be for housing in the island home. And I don't, something like that until we figure out what we're doing with it. I'm worried that a blanket override, because people are, they understand how the budget works. If the island home is an override, then we're freeing up something else. What is it used for? People are savvy to this. And I think the island home, we've got some tough decisions to be made. And I think, we have to have that stuff figured out. So anyway, I'd like to think about the room tax for that in the short term until we have done the negotiating till we figured out a path, till we've got the, a path forward. Otherwise, I think we are hurting our position. I'm hurting ourselves. Couple of the points that I thought about. NRTA, the steamship is really scary. The NRTA for me could be scary. We've got to get those numbers. And we may want to make some changes to that sooner rather than later, and to weather the short term. I think so. That's just a comment. The other, some of the line items are going up 18%, 7%, et cetera. I always look at that and I think about it from the, sort of the rule of 7% doubles every 10 years. Those were substantial. They don't look like a lot, but they're a lot, and it's health insurance, and it's, so I think, I'm worried that we've got a line item for, for human resources, but I want to make sure we're doing wage and benefit stuff. I want to make sure, we've talked about that, but we need to do that, and we need to, make sure we can afford what we're doing. We know what our parameters are. And, and you look at some of the things have gone up 30% in 5 years. That's a lot, on some of these expenses. And I think people, have to realize that, that if the bubble bursts, it could be really, unless we get a better handle on some of these items, when the bubble bursts, it could be really difficult. And so I think you're smart to be looking at that. But I think, when we negotiate and when we do some of this, we need to be really looking out 5 and 10 years.
Madam Chair, just one point to follow up. If an override were put on the ballot and was successful this year, it actually wouldn't free up any levy capacity because of the way that we funded Ireland Home last year. All it would do at this point would eliminate the use of free cash and retained earnings. Had we chosen to use it last year, it would have freed up. It would have created levy capacity that could have been utilized or left as unused levy capacity. If we choose to proceed with it, I want to make sure everybody understands that given that we didn't utilize it last year, all this would do would free up free cash and retained earnings. It would not create substantial amount of additional levy capacity. Just to make sure that everybody's aware of that.
Thank you for correcting me. That makes me feel a little bit better. But I'd still like it in the room tax, but it makes you feel a little better if I don't win that battle.
Melissa?
Thank you so much, Madam Chair. I just wanted to point out that, you know, the short-term rental tax revenue is significant, even if we're on a fiscal conservative path for tracking it. And I think that when we can use that revenue to solve community issues, it's a real asset to our community. And I would hope we would all keep that in mind as we move forward with the debate around any restrictions or provisions around short-term rentals, because as I'm seeing tonight, this revenue, which I think we fought very hard for through the state legislation, is going to be an asset to our community and can help us keep our community safe and healthy. So I just want to point that out. And then I'd also like to just say that, and I think Libby, you addressed this, but just to point out the elephant in the room is PFAS mitigation. I don't know that we have any way of forecasting what that could look like for us. And I think we should continue to be conservative in our budgeting because there are so many unknowns coming down the pike for us. So those were just two observations I had. Thank you very much for a great presentation.
Thank you, Melissa. Jason?
Yeah, Melissa, you had a great point about the community and kind of fighting for this. I remember it wasn't, it was a big debate between the community of adding this extra 6% on for short-term rental taxes. It was going to affect a lot of year-round homeowners who rent their house out, their cottage, and that was going to be a strain. So I want to make sure that some portion of this short-term rental tax goes to housing, number one, and then infrastructure. So I just think it's, if we need to make a motion tonight and have a dollar amount, or if we come back and continue to work with Libby and Brian, I just don't want this to, it's January and we'll see what happens. And we just kind of lose it with everything else that's going on. Unless you're right, PFAS is, what do we allocate? 400, 500,000. It could be double that. It could be a lot more. So I just want to make sure we leave tonight with something, with either direction or emotion with the short-term rental tax. So there's that. And then I had a couple of different questions. The CPE for our island home, do we know what that's going to be? I know it hasn't come in yet. And one of the things we had talked about the last couple of years is it's going to go down, 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 and we can't depend on that.
I believe, and I'll have to verify the number for that we should have received in fiscal 20, but I think it's around 1.4 million. We're working very hard, especially Rachel, the assistant town manager, is constantly talking to people at the state, trying to figure out when it's going to come in. We certainly will be filing the next certified public expenditure report, which would list what we would expect to receive in, I think I have to remember the years, but in the next cycle of the payment. So it's something that we've also said we don't know that we'll continue to ever get, because we suddenly have become the last remaining municipal nursing home in the Commonwealth. But it's certainly something that we're paying close attention to and trying to figure out, is this just a blip because of COVID and we haven't received the money, or is this something that is now gone? Which I don't think that any of us think it's gone, but we're still trying to sort that out and get a better understanding.
Madam Chair, can I have a couple more?
Yep.
Just I want to say thank you to town administration, finance, and all the town departments, because you're looking at the expense increase request, almost all of them are right in line with our strategic plan. So I just think there's nothing really that's out of there. So thank you for doing that. The stabilization fund and OPEB look really good. If you look at the last 4 or 5 years, thank you for putting that chart in there. And I think everyone on this board, or who's watching, who has the time to look at that budget message, that I know you put a lot of work into that, Libby, and it's really good of the why. You can look at all the graphs, but understanding the why behind it all helps a little bit. So great report.
Thanks, Jason. I'm not sure that we should make any motion tonight about the trust fund because I don't think that there's not the financial capacity the way the budget's currently drafted, but I think it's something that we should think about and come back with. Does that?
Oh, sorry.
No, go ahead, Libby.
I was just saying, it's very much on our radar based on these discussions that the board has had about it. I think Brian and I are just trying to, we have a discussion with town council later in the week about a variety of things relating to town meeting, and this is one of them. We just want to sort of talk over how best to allocate, and it may just need to start out as a policy. I think, Madam Chair, you and maybe Jason and I, or maybe Jason, you and I just talked about this. We were going to perhaps have a small little work group with one of you and Brian and I and maybe one or two others, just to go over what amount we think and what our baseline might be and that sort of thing. I mean, we are really hesitant to increase that projection number, but we hear what you're saying, that the number that came in already is much larger than that. So we might be comfortable with increasing that projection by some amount and dedicating that to the Affordable Housing Trust or something like that. We need, I don't think we're quite ready tonight to have a motion.
I mean, could I make a suggestion that Christy might want to be the one who's involved since she's the Affordable Housing Trust Fund representative? Does that I can go to Christy, who had her hand up?
Yeah, I'm happy to do that. I was just going to ask, would it be possible to see next week some of those budget options for providing funding to affordable housing, or is that something that would come at the January 6th public hearing?
It doesn't even, okay, a couple things. I don't know that we have the capacity to get something for you next week, just because of other things that are happening between now and Friday afternoon. We can try. The January 6th is just a public hearing. If we are moving town meeting, which I think we are, we do have more time to work on things like this. I don't want to stretch that out too far because I don't want to get too comfortable with, oh, we have loads of time because now town meeting is going to be out more. So I don't want to give us too much more time, perhaps 3 to 4 weeks, but even that would give us more time to develop something a little more solid. Brian, do you think?
I think so. And I think one of the key points that we would want to look at, quite honestly, in figuring this out would be, what does the December payment look like? Because historically, we have the two largest payments that we received have always been the September and December payments. We've either met or exceeded the budget based on those two payments just because of the sheer nature of the seasonality on the island. So I think that the December payment, which will, again, just to remind everybody, will be for October and November, will certainly be a better indication, coupled with the October payment, of what may or may not be possible. So I don't want to push this out too long, but I also think that it would be in our best interest to see what that payment looks like, to give us a better indication of where we think we might end up.
That seems fair. I'd also, just before we end, I'd like to I'd like to say that I do still support the override for the island home. I do think that it's important for us to commit as a community to the long-term funding of that actually before we finalize building a new facility. And I just, my opinion on that hasn't changed. Is there anything else on?
Do you? I don't think we have anything else, but we'll include Christy in our discussions about the dedicating funds out of short-term rental to Affordable Housing Trust.
Thank you. Move on to capital projects.
All right, so we've got Rick Sears, our Assistant Finance Director, is going to take us through. Thanks, Rick.
Great. Thank you. So this is the third update for FY22 capital. And like the update before this, I'm going to try and focus more on changes than going through all the discrete projects. So first thing on the agenda is progress update, just a quick flyover of what we've been up to since I last presented to you. And then updates to the general enterprise funds based on the town manager's direction. And for those of you who've had a chance to look at the deck already, you'll note that it now includes funding sources. There's a proposal for funding facilities projects, quick review on debt exclusion projects, and then a summary of the town manager's recommendations by funding source. So Erica, if you could change the slide, please. Thanks. So last time when we ended the meeting, we had some things that we were tasked to do or intended to do, including completing the Capcom departmental reviews done. We, of course, had the joint meeting. I hope everyone found that useful. The town manager was to complete her prioritization, and that's the main topic of tonight. Brian was working on completing the funding sources, and as you can see, they're in the deck. And we rolled out the capital software to Select Board and FinCom. There was one item that we flagged last time as a potential financial requirement around the financial assurance mechanism out at SWEF. We said at the time we expected a mid-December update. We don't have an update on any obligation there. So Erica, please. So I'm going to go through the departments, and I'm just going to focus on the changes. So starting with facilities, the top 8 projects there, the first lines you see above the yellow highlighted cell, those are all the same that you've seen in the past. The only difference here is that the funding source says facilities borrowing. And I'm going to talk about that facilities borrowing in about 3 or 4 slides. And so if you look at that yellow highlighted cell of 2.149 million, the title is future projects. That's a plug number to get us to $6.5 million request for facilities funding. But I just want you guys to hold that one for a couple slides, and I'll come back to it. Moving to the middle of the table, transportation, 2 changes. Cobblestone improvements was decreased from 500 to 250, and the road improvements was increased from $1 million to $1.25 million. So 1 up, 1 down. And then at the bottom of the page, the public works projects, that is identical to what you saw in the past, with one exception. The DPW director has determined that the no-bid artificial turf improvements can be moved out to FY24. So that resulted in a removal of $250,000 spend. Erica, please. So Marine, Police, and School, no changes to the Marine requests. The 2 stand as they did last time. Same for Police. 1 change to school. So the school campus-wide improvement plan, so that's the baseball diamonds, the tennis courts, the parking, the lighting, the security. That has been reduced at the direction of the town manager from $1.276 million to $1 million. Erica, please. Fire, IT, and town admin. So 1 project was removed from fire, the trench and technical rescue equipment. That was in for $220,000. That's been removed. No change for IT. 2 changes for town admin. So the harbors plan was reduced from 150 to 100, and then also removed from the plan was the underground wiring feasibility study for $500,000. So the town admin request has gone from $1 million to $450,000. The enterprise funds, there are no changes to the enterprise funds. The only change to this slide is the funding sources that are articulated on the right-hand side of the slide. I guess I could ask if there's any questions just before shifting gears. No? Okay. So I had flagged at the top of the DPW that we were going to come to you with a proposal around facilities.
Oh, actually, Rick, we have a public question.
Oh. Okay.
If you don't mind pausing for 1 second, Rick Atherton has his hand up.
Dawn, can you hear me?
Yes,
Hello?
Rick. Yes,
Sorry.
Rick, go ahead.
I think I'm 10 minutes behind in my technology. So my public comment is more related to your last discussion about budgets. If you'd rather wait till next week when it sounds like it's coming back, that's fine with me.
Okay, Rick, we'll pause that for our next discussion.
All right, thank you.
Yeah. Go ahead, Rick Sears.
Eric, if you can just put the slide back up. Thanks. So as I said at the beginning, when we were talking about DPW facilities, we'd come back to it with a proposal for funding these projects. The reason we're coming with the proposal is that it seems that sometimes we find that the cost estimates for these facilities projects are insufficient, and they're insufficient for a variety of reasons. It could be lack of scope clarity, which we're working on at Capcom with the department heads, but also unknowns of the project, particularly when it's a maintenance project and you open up a wall and you find something that needs to be abated, or the unpredictability of the input costs of labor and materials. Whatever the reason, the outcome results in delayed projects and increasing costs. And so this proposal would provide a more efficient and time-sensitive way to fund these capital improvement projects. And the proposal is to do it through a borrowing. So we would propose to borrow a sum of money where the debt service, so principal and interest, is roughly equivalent to $750,000 per year. The debt service would require, in order to service the debt, it would require an annual allocation of free cash in a like amount, so $750,000. At current borrowing costs, we believe we could borrow somewhere between $6.5 and $6.9 million. And what would happen then is the town manager, the finance director, the DPW director would determine a small handful of projects, 3, maybe 4, maybe 5, all that could be completed within a year. And we would get the cost, determine the projects, get the cost estimates, and fund it all sort of in a tighter time window to hopefully avoid some of the problems that I just highlighted above. And so when each of these projects would need to be completed within a year. As they complete the projects, we would have other candidate projects that we would then, again, get the cost estimate, do the borrowing, and execute the project. And we would continue to do that until the $6.5 million was exhausted. So we think that through this proposal, we'll achieve sort of a more focused project list, a better time-synced approach to funding, leading to fewer project delays and less cost escalation. So I think, in short, it feels like better execution and better financial management. And I would like to recommend this as my own proposal, but it happens to be Brian's. And so I think maybe I'll just pause for a second to see if Brian wants to add anything to this or if there are any other questions.
I think the only thing that I would add is that this came out of discussions with DPW director, the assistant finance director, the town manager when we were going through capital, and just seeing how we were allocating small amounts for various capital items such as plumbing or HVAC systems. And when projects came up, we maybe had 1 or 2 years of the allocation there, but we were limited in how many projects we could do because by the time we got to them, potentially the costs were much more than we had anticipated. So I think that this is a way, and I do recall that in the past few years, certainly one of the board's directive is through the efficient town operations is focus on maintenance and infrastructure. And I think this is a way to give us the ability to, as Rick said, to have some very focused projects on an annual basis that we feel confident we can get done, and we have the funding to be able to get done in the event that something happens and we don't have to continuously run to try to get supplemental appropriations and or look for other available funding within all the capital appropriations to move forward. I think this will produce better results on a more timely basis and at a better cost, to be honest with you. And one other note that I would say is that when we look at this large number of potential authorization of $6.5 million, we would certainly use the same premise that we have. We never run out and borrow the full authorization. We do bands for the amounts that we need for cash flow purposes, and we would then permanently borrow at varying intervals, or if it was within the 750,000 that I proposed allocating from free cash, we would just simply pay that band down and move forward with the remainder of the borrowing.
Okay. Well, if we can move on to the next slide then. So debt exclusion projects, just the high level overview. You've seen this before. The difference here is two things. One is the dollar request is now included, and one project was removed from this from the last time we had put in a very preliminary estimate around the Tom Nevers playground at 1.7 to $2 million, but that has been removed from the current recommendation. And so finally, on the last slide is the summary of the funding sources for this capital request. So free cash of just under 5 million, which you saw in Brian's presentation before. Just say that includes 19 projects in there. So a lot of small projects. The four largest do consume about 60% of the 5 million, and that's the roadway improvements, the campus improvements, the police radios, and the NPS building improvements. The facilities borrowing, we've talked about it just now. The debt exclusion projects are 5, which I just highlighted to you. Capital exclusion, that's for $751,000. That's 7 vehicles. The two big items are sweeper at $250,000 and a 6-wheel dump truck at $180,000. The borrowing is for the sidewalk improvement plan, as well as the replacement of engine number 4. And raise and appropriate is the F Street bulkhead repair, as well as the Loran sewer, or the sewer connection and removal of the septic. And then finally, the ambulance reserve is for the ALS equipment. So the total is $26,797,047. And that's all I have for you tonight.
Does anybody have questions? I can't see all the board members. Jason?
I think the proposal of borrowing for the facilities is a great idea. I think it's one of the many advantages of having Rick Sears here and this new position of being able to work with Brian and working with department heads to think creatively and with a ton of oversight, but to think creatively of how to move fast and how to get things done quicker with all the oversight. So I think this is we didn't really talk about it and discuss it here when it was presented, but I just wanted to say it was reviewed a lot at Capcom, and they've done a lot of work on it. So if the board have any other questions, please ask, because I think it's a really interesting way to get what we want done with facilities. Thank you.
Matt?
Yeah, I agree. It might be, we're painted into a corner, and it's probably the way we're going to do it. But sort of how I view it is, if you have a building that you set aside 2%, 3%, 5% a year every year into a maintenance and repair fund, so that money is available. And unfortunately, what we've done is we've spent that, in wages and in a bunch of other things. And so, so those expenses, they are crowded out. Like a regular business would put that aside. And then if they had a huge one, they might get a loan. But for the most part, most people don't get a loan to upgrade their HVAC, for example. And so I think that we've done this to ourselves. What I would love to see us move toward is, putting a line item and upping our capital requirement so that money is there, and that we're not going out and borrowing it. I think that's, and we're not going to get there right away, but long term, we should be thinking that way. When we build these very expensive buildings, part of that what we should be thinking about is, how are we going to maintain them, and how are we going to maintain them within the known parameters that we have, and not spend every penny so that we have to go and get more loans. So I just, I know I'm probably old school, and do stuff when I've raised the money, when I've earned enough, and I don't like a lot of debt. but I just think there's another way to look at this. I think what they've done is great, you know, because we painted ourselves into a corner. But I think that we really need to start thinking about, we're getting ready to build some more substantial buildings. And if we don't change, you know, the structure of how we do some of this stuff, we're going to be back in this situation in 10 years, and it won't be that amount. It'll be something 10 times bigger.
Anybody else? Christy?
Thank you. Rick, I'm just wondering if you could walk through some of the projects like Newtown Road. Every year we hear that the voters have concerns and it wasn't clear. So I just thought while we're having a public meeting, it'd be a chance to explain what those projects are.
Projects in addition, other than which ones in particular, other than Newtown Road? And
Just that was on the last slide of the screen.
the debt exclusions.
Yes, just the ones that were presented last year.
So Newtown Road, I understand, was presented last year. I think the scope of it remains the same. I think the some of the comments that we've had are that the residents didn't know what was happening last year on Newtown Road, and it continues with the same notion of public walkway and speed cushions and the like. I don't think there's any change to that from last year's request. I'm not sure I'm prepared to actually go through each one of these in detail. I think it would be helpful if we had the department director present, which we could of course do next time. So Surfside Area Roads, Lovers Lane, I think that's been in the plan for, again, a number of years. I don't think the scope has changed substantially. Waite Drive, of course, is for the required for the new Tacoma Way, and the Children's Beach Pump. I'm pretty sure we're all familiar with what the requirement is there. And then the final one is the supplemental funding for the Nobody Fieldhouse. I know I'm just reading the slide again, but the plan for the Nobody Fieldhouse, for instance, exists. I think we've seen it here at Select Board. So if we can come back another time with more detail on each of the projects, if that's what you'd like. But I don't think the scope has changed on any of these, Waite Drive being sort of the newer of the ones on here.
Madam Chair, could I just add a little bit to that? Part of the problem last year was, of course, that we ended up having the election before the town meeting. So there wasn't the usual discussion at town meeting that might have informed people about the election. And then we didn't even put these on the town meeting. So that was, an anomaly that hopefully won't happen again. But the Newtown Road item is, as Rick said, and we certainly could have the DPW director come in and review Newtown, the Surfside Area Roads Phase 2. In fact, all of these really are DPW projects. He could certainly come in and review them if the board wants to. He has reviewed some of them already before the board. But if these go forward, I think we would have a pretty robust public outreach plan to do videos, and I can't even think of it right now, but all the usual public outreach things we do. We did suggest and have suggested before that citizens could certainly, if these are initiatives that they support because it's in their area, they could certainly get behind public outreach also and send letters around to neighborhoods. That doesn't seem to have materialized recently, but that is certainly something that they could do, and we could potentially help with, but we have to be careful with spending town funds on ballot questions.
Thank you. And yeah, that was just more so to bring these back to the attention of the voters, since they've been really controversial the last couple of years. Thank you.
Is there anything else on capital tonight? Good job.
Thanks.
Thank you very much, Rick. That was excellent. The next item is, well, we're done with town manager report.
Select board reports and comments now. Review final draft potential adoption of 2020-2021 strategic plan update. I
So
think,
Madam Chair, sorry.
no, go ahead.
Okay, quick overview. As the board will recall, normally the strategic plan is updated in June or July. And last few years, you've been doing a retreat. And we did do a retreat again over a 2-day period with facilitated sessions, but it did not occur until October. So it was much later than it normally would be. There is a report in your packet from the facilitator developed through the feedback from the board. We used an informal polling method to try to gauge consensus on some of the issues. And there is a draft framework in your packet. So in a nutshell, I think as you all know, and you can certainly all add to this, but just quickly going through what has been modified for the strategic plan update, or update, redone kind of. I think you re-reviewed the principles of sustainability, and that may have had a minor change. I can't even quite remember. We added a couple of areas of strategic focus, or maybe it was one area of strategic focus, and you re-reviewed what we call the aspirational statements of each strategic focus area. So those are all lots of big words, but for the public's information, we basically have 5 areas where goals are focused, and those are housing, transportation, environmental leadership, efficient town operations, and quality of life. And at last year's strategic plan, or the current strategic plan, so most of these had goals, but some did not. And so you added goals to quality of life and I think quality of life. And there was a update. Some of these goals were updated. Housing had 2 additional goals added to it. I guess it was just housing and quality of life goals added. And everything else is pretty much unchanged and moving forward. Janet, I probably didn't say all of that quite the way you would have, but would you add anything?
No, I think you got it. There was a small change to housing and we added stuff to quality of life.
Yeah. Okay. So I guess
feedback. Do you want feedback?
Sure.
Because what jumped out at me right away was housing. Goal number 4, I don't think that we had a consensus on that. And the wording concerns me in terms of exploring options for limiting the conversion of year-round housing to short-term rentals. I don't think that we have fully developed any kind of strategy for that. And I am personally not ready to support that as one of our defined strategic goals. I think that we had previously talked about trying to incentivize the second dwellings and maybe even tertiary dwellings as year-round rentals, but I don't feel like that other part is developed or that it actually rose to the top of what we had talked about. The last one was the one that I thought we had full buy-in on. That's just my feedback. Other board members might feel differently. Christy?
Thank you. I was looking at that, and I think what we had first discussed was limiting short-term rentals, and the board didn't support that language. And we thought that limiting the conversion from year-round to short-term rentals was something that we wanted to at least explore policies, not necessarily have something that we're ready to enact right away. That was how I felt about that statement.
Matt?
Yeah, I think maybe it's the word limit that is throwing people off. I mean, I think we have to explore how do we not have this continue. This is, or how do we put incentives in place so it slows down? It isn't at the pace it is now. I think we do have to explore how to do that. It is sort of what is driving, what is making it very difficult for people to remain here and to buy homes and remain here. And, and the Islander neighborhoods that we all, everyone assumed would be, sort of for the middle, upper middle class, the working people, are now turning into short-term rental neighborhoods. And so and they throw a pool, they're larger lots. You can have the pool, you can have the second house. This is great, and it isn't great if we're trying to keep people living here year round. And so somehow we have to get to that. I agree with you, Don. We don't have the answers yet, but I think we do have, I think we have identified, in my mind, we've identified the problem. And the other goal that's kind of missing in housing is a funding source. I think a couple of the things we have there are a little wishy-washy, but if we wanted to add a funding source, that would be something that might be doable. A couple of the other ones, I think are a little wishy-washy.
I have a big problem with the language that says limiting, and I actually don't think that we've identified that as a true problem. And I think that there needs to be a lot more research done on that. Some of the statements that are circulating out there, I don't actually see the full evidence of those. And I'm afraid that we're getting caught up in that without really digging into it first ourselves. I don't think that what you speak of is happening, at least not in the degree that you're saying it's happening, Matt. But that's my opinion. And I also, it's a slippery slope because you're talking about limiting people's property values when they go to sell who might have owned their home and it's their retirement plan. So I think that there are a whole bunch of things that play into that. And I'm just not ready for that to be a goal that I can support.
And I'll come back. I don't think I have the answer, Don, but I do know it's, when I was a kid, the end of Fair Street was affordable housing. And the march has been on for 40 years, my entire life. And where is it? When does it end? And so really, and I think there are numbers out there, they have them through the data project. We know how many, sort of less were available for that. There is a lot of data out there. I understand the politics of it. I understand it's going to be politically difficult to talk about it because of the value of these conversions is going to make it difficult to politically talk about and deal with. But I think that we have to be willing to try to deal with it, as a community. Maybe it's not us as a board, maybe we won't do it, but I think at some point we have to, sort of have those difficult discussions.
All for the discussion, but I'm not ready for this to be one of our goals. Melissa?
Thanks so much, Sean. I'm toggling back and forth between my PDF that's open with the goals, but I'm just wondering if perhaps we're comfortable with the first half of the sentence, which is just identify incentives to encourage homeowners to use secondary dwellings as year-round rentals. That seems to me to be in alignment with the conversation we were having. And I'm with you. I'm not 100% sure that I'm convinced that the affordable housing problem rests at the heels of homes being sold out of what would be year-round stock and converted into short-term rental or seasonal resident homes. I think the value of home prices is driving that decision more, and the year-round families are just being priced out of the market is what's actually happening. So if we wanted to talk about in terms of the strategic plan and that initiative, I would put forth the recommendation to just drop the second half of that sentence as a goal for us.
Christy?
Thank you. I was just trying to think of ways to reword that as well, because I think at least my intention of it is trying to keep as much housing as year round as possible. We've heard from the data platform last year, and I think the year before, when they were doing estimates of what our census numbers were going to be like, that we've seen, I think, almost 600 units turnover from year round to non-year round. So I don't think that necessarily means short-term rentals, but I think it is losing our year-round housing stock. So I don't know if there's any appetite for rephrasing it to explore options to incentivize year-round housing, or not. So it's not just second dwellings, but how do we get more stock available throughout the whole year? And I think if we really do want to tackle affordable, we're not just talking about 40B, but affordable at all home ownership and rental opportunities. And I'm not sure if anyone saw the WPI presentations, but the average home price on Nantucket for 2020 is over $2 million. So I think we have to start thinking about how do we keep some of those houses in our year-round stock that are in that 1 to 1.5 million range, whereas before that wasn't really what we were considering.
Christy, I'm glad you said that, because I was just starting to think about that. I could very much support encouraging things to stay as year-round stock, and possibly something along the lines of an expansion of the different levels of the covenant program that's been wildly successful on the island, and has really opened up a lot of opportunities for many people that we know to stay here. I guess I thought that develop a strategy to increase home ownership opportunities for middle income. What kind of did cover that, but maybe it needs to be a little bit more detailed on incentivizing things to be year-round housing. The limiting concerns me. Rick Atherton has his hand up. Shall I go to public comment? Rick?
Dawn, thank you. Can you hear me?
Yes.
Just a general comment on the conversation. It's a conversation we need to continue to have, and I think expand its parameters. I have a general feeling that I don't think we can build our way out of the affordable housing issue. And in my own mind, that's sort of what the $20 million was related to a year ago. The intent was to convert existing housing to affordable housing. I think at some point the board needs to discuss whether or not, if we hit the 10% state threshold, it intends to continue government support of affordable or public housing, or at some point do we recognize the taxpayer has done its share and we need to concentrate on private parties that lead to increased demand for housing to accept the cost related to that housing for their employees. So we need to broaden the conversation, at least in my opinion. Thank you.
Thanks, Rick. I mean, that is actually an important point, that when we're talking about housing, we're not just talking about shy units. And I think that that's one of the conversations we're having tonight, is how do we broaden opportunities for things to stay in the year-round housing stock. And maybe they do have to have some restrictions, but then there has to be an incentive to put the restrictions on them. Matt, you had your hand up?
Yeah, no, I think, and you're right. Like, there are ways that we can do it. We can tier fees. We could tier sewer fees. We should be looking at all of the regulatory and zoning ways we can do it. In Aspen, Colorado, if you're going to build a big business, you have to provide the housing that business will require. If you're going to build a 4-story building, it's their zoning is at 3. You're going to build 4. One whole floor has to be affordable, 1/4 of it, there or elsewhere. There are, but when we talk about those things, people don't want that either. So it's that's the difficulty of the conversation. It's like people want the zoning without any, they don't want to give anything back for that. They want to have twice as much value. They want 2 lots, but they don't want any restrictions on it. So we should really have to look at all the different ways we can do it. And sometimes I think, money isn't going to solve it. We can't make enough money. We can't find enough money to solve it if all we're going to do is create more market rate homes and we don't have any restrictions. We need to get to a bifurcated market with 10-20% of the houses on the island in some sort of protected status permanently. And we can do that through zoning. We can do that through regulation. There's a bunch of ways to do it, but we have to admit that that's necessary. The people that are buying here are competing with people that they will never be able to compete with. And that's, that's department heads. That's our most highly paid town employees can't compete in the stratosphere of the people who are coming in and investing now. And so, how do we do that? That's going to be especially in between all the other competing needs is really, that's the difficult question.
Brooke Moore has her hand up. Brooke?
Can you hear me?
Yes, go ahead.
Hi. I love that we're having a good and thorough conversation about housing. It is a complex problem that's going to require using every tool we have in our toolbox. But at a median home price of over $2 million, this can't be done without significant funding. To just try to do it through zoning means we have to encourage development to create affordable housing. That might solve for the future affordable housing needed to support the future development, but that will not solve the shortage of housing that exists today for people who are here servicing the growth that has already happened in our community. So we are way behind. And I happen to believe very strongly that without a significant, stable, and ongoing funding source, we cannot catch up to the point where zoning can solve the problem. Thanks.
Thank you, Brooke. That's a good point. I wanted to address something that actually Rick Atherton said earlier too, was that about employers and providing housing. I believe that is a provision in the MCD, inclusionary housing, but I also just know that there are many employers on the island that provide particularly seasonal housing and an awful lot of it. But the problem we start to run into when people really make Nantucket their permanent year-round home, they don't want to live in employee housing. They want opportunities that are independent from the business that they work for, something that feels like a more permanent place that's theirs and not necessarily dependent on their employment. So I think that I'd like to rewrite this goal a bit, and maybe we don't have to decide that tonight, but I think that this has been a good conversation. Jason, then Melissa, did you have your hand up too? Jason, go.
Yeah, I just wanted to give my support on either removing that second sentence there or I think what Christine, Melissa, you all have said about adapting it, which is similar to other goals we've had, but I think that's fine as well, adapting it to preserving whatever the words are, year-round housing and taking out the limiting part and short-term rental tax. Then I also, I feel like it's been pretty clear in my short amount of time here on the select board that even if we hit the 10% shy tomorrow, we have major challenges for housing. I mean, then there's examples on the Cape. P-Town has hit 10% or did recently, and they're in the same boat we are. I mean, they're struggling, and you can drive there to even work. Right? And it's so we've got, if we hit 10% today, we have 10 years of challenges, and we are going to have to fund some of it. Taxpayers, we're going to have to spend time figuring it out.
Melissa?
Thanks, Don. I just to bring it back to the strategic plan goal, would you like some time to, how do you want to move forward with this? Do you want us to make suggestions to change that sentence, that language tonight? Should we sit on it? Are we planning to bring this back? Are we looking to adopt this plan as is tonight? I'm just a little unclear on what the next steps should be.
I mean, I'm happy to have more suggestions thrown out tonight, but then maybe Julia or Libby, maybe someone comes back with a suggestion based on our conversation, or we can. I don't always love us trying to rewrite things in the middle of these meetings. But
I agree. I think that my suggestion would be that perhaps we take another look at this and bring it back. And I think, if board members have suggestions on how to sort of recraft that, we could send them to you or and just take a stab at it. I am with you. I think that the intention behind that was just a slightly misrepresented, and so we need some language tweak on it. But doing it on the fly tonight might not be the most productive use of our time.
Does that sound good, Libby, for us to think on it? And
Sure. I don't know that there's going to be time to get something revised for your packet for next week. Do you want to put it on next week, or do you want to put it on in January?
what do you guys think? I think the first meeting in January would probably be fine.
Okay.
I would support that.
All right. So if people want to send their suggestions to me, our internal team can sort it through with Janet and the others. And maybe we go through it with the chair and vice chair when we're setting the agenda for that meeting.
Sounds good. Thank you. Did anybody, I mean, we got kind of caught up in the housing, but did anybody have any thoughts on the wording for the quality of life? I was happy with those. I really thought that was a big progression for us to put some words to what we see as major ways to improve quality of life for our community. So that was just my thought on that. Okay. Well, if there's nothing else on the strategic plan, I did love the choice of the most crowded event of the summer on Main Street for 2020. Something we absolutely couldn't do this year.
Back in the day kind of thing.
Yeah.
Come up with something else if you want.
No, I liked it. I thought it was good irony of what we're aspiring to.
Yeah, that's true.
So next up is committee reports. Melissa, I think that you definitely had an update.
I do. Thank you so much, Dawn. So I'd like to update the group on our diversity, equity, and inclusion officer search. Our hiring committee met, oh my gosh, I can't remember if it was early this week or late last week, but we've met recently, and what we've decided to do was there were some applicants who were still very much of interest to us. So we have selected from the candidate pool that had still existed, and we are re-interviewing candidates next week. If we do not find the right fit in that candidate pool, we will repost the job. So I hope to have an update for you. I'm not sure we'll have an update at next week's meeting, but do my best to keep you all posted on what's happening with that.
Thank you. Does anybody else have an update on any committees? Okay. I know we're all working on lots of things.
Matt made a motion and I'll second it.
Thank you. All those in favor by roll call: Christy Ferrantella.
Aye.
Matt Fee.
Aye.
Melissa Murphy.
Aye.
Jason Bridges.
Aye.
Don Holgate, aye. Thanks everyone for tonight, and thanks for ending before 8 o'clock. Bye.